Namaste everyone. Very soon we will start our today's international conference. Um, in a few moments, all the guest speakers will be with us. Welcome, Dr. Deepmala. Dr. Shivani Burel has also joined us.
Thank you, Dr. Shikha. Wish you all the best of luck for today's event
Thank you so much,
and
ma'am.
heartily
Very soon,
congratulations.
thank you so much, ma'am. Very soon we will officially start this international conference. Uh, Let us wait for a few seconds for all the guest speakers to join us. Good morning, Dr. Shivani. Our advisor, sir, will be soon with us. Our president in charge, sir, is also there.
सर एक बार आप उसको
Good
पॉज
morning,
करके
sir.
पूरा
Dr. Vishwa Vasuji is also among us, and all the guest speakers are joining. Vedic Kashinathji sir from NIA Deemed to be University is already here. Technical team is prepared for this international conference. Namaste, everyone. We are trying to connect with our pro-president Ayush, Dr. Kamleshji sir. All the dignitaries are present here. Very soon, within the seconds, we will start this international conference. Namaste.
Hello. Ah,
Namaste, sir. Namaste, everyone. All the guest speakers and dignitaries are here among with us. And without any
नमस्ते
delay,
एवरीवन।
Namaste, sir. Namaste. Namaste, everyone.
नमस्कार
Without
सर।
any delay,
कमलेश सर कैसे हैं?
एकदम फिट फाइन, बहुत बढ़िया। आप सुन पा रहे हैं मेरे को?
हाँ जी बिल्कुल, आपकी आवाज आ रही है, अच्छे से सुन पा रहे हैं। शिखा मैम स्टार्ट करें।
ठीक है।
yes, sir. Um, with the lamp lighting ceremony, we will take blessings from Goddess Saraswati for the successful conduction of this 2 days international conference. So I would like to request our honorable advisor and CEO sir to come among us and lamp lighting ceremony. Sir, over to you, sir.
He'll be joining us in a short while, in a minute or so.
Okay, our honorable advisor, sir, will be joined soon. It is the Indian tradition. We always take blessings from our goddess Saraswati before starting any academic or research work.
Namaste.
नमस्ते सर।
Namaste, sir. Our honorable advisor, sir, is here. So I would like to request all the guest speakers, please stand for a few seconds so that we can take blessings from Goddess Saraswati. Sir, I would like to request you for the lamp lighting ceremony.
Thank you. Jai Mataji. May Goddess Ma Saraswati bless this conference. Thank you.
थैंक यू सर।
Please be seated, everyone. Jai Mata Di. Now it's time to officially start this international conference. Namaste, Honorable Chairperson Ma'am Srimati Mithilesh Garji, Honorable Advisor and CEO Sir Vedant Garji, respected Registrar Ma'am Dr. Hima Bafla ji, President IC Sir Dr. Pramod K. Raghav ji, Co-President Ayush Dr. Kamlesh Sharma ji, and all the renowned speakers of today's conference, Dr. Sanjay Pokhriyal ji from Nepal University, Dr. Ulrich Berg, Dr. Ramdeep Sharma ji from Ujjain, Dr. Kashinath ji sir from NIA deemed to be University, Dr. Vishwavasu God sir from the member of BOD and from Chomu College, Dr. Shivani Borel, Associate Professor, YMTRCC College, Dr. Abhishek Sharma ji, uh, President Sevarat Yoga Prakritik Chikitsak Sangh, Dr. Deepmala Yadav ji, and all the valuable guests, adored professors, faculty members, and my dear students. A very warm welcome to all of you. On behalf of the organizing committee, I, TVN Dr. Shikha Sharma, would like to express my gratitude to all the valuable guests and research scholars, learned academicians who are joining us today in this 2 days international conference on stress relief and lifestyle disorders management in context of Ayurveda. So, I'm extremely excited to share with you all that recently we have completed our 15 years of academic excellence. To celebrate this journey, we are organizing various international conferences under 6 different faculties. Today, the Faculty of Ayurvedic Science, including Yoga and Naturopathy, have organized international seminar. So I would like to extend my best wishes to all the participants and presenters who will share their research findings and valuable knowledge with us in this conference. We all know that health is the greatest wealth, but also health is not valued till sickness comes. In present scenario, a lot of physical and mental disorders are affecting a larger population worldwide. But Ayurveda, the age-old science of life, always emphasizes on health maintenance first and then prevention from diseases rather than treatment and cure of diseases. Yoga and naturopathy are also today very effective therapies against such lifestyle disorders which are threat to humanity. We hope that this conference would provide ample information to the learned society and will explore the hidden messages of Ayurveda and naturopathy in modern language. The conference will surely benefit you in many ways at free of cost. Always remember your health is an investment, not an expense. So, without any delay, I would request our honorable, dynamic CEO and advisor, sir, please bless us with your inspirational words. Over to our honorable advisor, sir.
Namaste. Very good morning to all. Namaste, all the invited keynote speakers, our faculty members, students for this 2 day virtual national conference, which is being organized under the Faculty of Ayurvedic Science on the theme Stress Relief and Lifestyle Disorders Management in Context of Vedas. India is known for its traditional medicinal systems and medical systems, which are found mentioned even in the ancient Vedas. So it is important for researchers to incorporate the evidence of knowledge described in our ancient Vedas into the new medical systems, as well as study the virtues of Ayurveda with the integration of modern medical pharmacology and diagnostic methods. I hope this conference serves the best virtual conference experience to all the participants so that they can share their research work in form of integrated and correlated based research papers. And I extend my best wishes to all speakers, faculty members, organizers, students, and the research scholars for a successful and fruitful conference. I extend my sincere thanks to all for joining us at this 2 day international conference 2023. Thank you so much. Namaste.
Thank you, sir. Jai Mata Di. Now, I would like our Pro-President Ayush, Sir Professor Kamlesh Sharma ji, to brief about the conference Sir, please introduce all the guest speakers about this theme of our international conference.
यज्जाग्रतो दूरमुदयित दैवं तदु सुप्तस्य तथैवेति दूरंगमं ज्योतिषां ज्योतिरेकं तन्मे मनः शिव संकल्पमस्तु। धन्यवाद डॉक्टर प्रोफेसर शिखा जी। आज के इस 2 दिवसीय अंतर्राष्ट्रीय आभासी पटल पर होने जा रही सेमिनार के उद्घाटनकर्ता और ज्योति विद्यापीठ वुमेन्स यूनिवर्सिटी के सीईओ और एडवाइजर श्री वेदांत गर्ग जी, रजिस्ट्रार मैडम हेमा जी, इंचार्ज प्रेसिडेंट प्रोफेसर पीके राघव जी, डीन फैकल्टी ऑफ आयुर्वेद प्रोफेसर शिखा जी, सारे फैकल्टी मेंबर्स, आयुर्वेद संकाय और योग नेचुरोपैथी संकाय और इस वर्चुअल पटल से जुड़े हुए सभी पार्टिसिपेंट्स, इन 2 दिवसीय आभासी पटल से हमारे साथ जुड़ने वाले देश विदेश के सभी गेस्ट स्पीकर, उनमें उल्लेखनीय जो प्रोफेसर पोखरियाल जी जो हमारे एनआईयू के एलुमनाई रहे हैं, नेपाल में आयुर्वेद का झंडा बरदार हैं, वहां का एक तरह से यहाँ से राजदूत बन करके वो गए हैं आयुर्वेद का। डॉक्टर काशीनाथ समगंडी जी स्वस्थ विभाग में एसोसिएट प्रोफेसर हैं और देश विदेश में अच्छा काम, योग, स्ट्रेस मैनेजमेंट, लाइफस्टाइल मैनेजमेंट के नाते उनका अच्छा अनुभव है। डॉक्टर विश्वावसु गौड़ जो वर्तमान में बोर्ड ऑफ मैनेजमेंट सर्वपल्ली राधाकृष्णन राजस्थान आयुर्वेद विश्वविद्यालय के भी सदस्य हैं और एमजीएफ आयुर्वेद कॉलेज में असिस्टेंट प्रोफेसर स्वस्थ व्रत हैं। बहुत अच्छा काम अपने फील्ड में कर रहे हैं। इनके अलावा देश भर से और जो भी विषय विशेषज्ञ हमारे साथ हमारे निवेदन पर जुड़े हुए हैं, उनका मैं ज्योति विद्यापीठ वुमेन्स यूनिवर्सिटी परिवार की ओर से हार्दिक स्वागत और अभिनंदन करता हूं। इस प्रकार के किसी भी आयोजन में जब जब हम उन लोगों को याद करते हैं, उनका सहयोग और हमारे पार्टिसिपेंट्स को उनका मार्गदर्शन हमें प्राप्त होता रहता है। जैसा कि इस वर्चुअल सेमिनार के शीर्षक से ही हम सबको पता चल रहा है, आज हमारे ध्यान में आता है कि दिनों दिन फिजिकल इवेंट्स के बजाय शारीरिक व्याधियों की अपेक्षा मानसिक व्याधियों का व्याप संसार भर में बढ़ते जा रहा है। ज्योति विद्यापीठ ने एक परंपरा प्रारंभ की है और इसके अपने 15 वर्षों के एकेडमिक कैरियर में वैदिक आधार मानकर वेदों से सब प्रकार के ज्ञान की उत्पत्ति है, ऐसा हमारा दृढ़ विश्वास भी है। तो हम ये मानते हैं कि संसार के हर प्रकार के समस्या का समाधान वेदों के माध्यम से संभव है। हाँ, उस विषय के विशेषज्ञों की ये जिम्मेदारी बन जाती है कि इस प्रकार के प्रसंगों को, इस प्रकार के संदर्भों को युगानुरूप संदर्भ देकर आज के समय के अनुरूप हम किस प्रकार से इन सब चीजों को प्रस्तुत करके विश्व के स्वास्थ्य संबंधी समस्याओं का समाधान हम कैसे कर सकते हैं। आयोजक टोली ने और ज्योति विद्यापीठ प्रबंधन ने जो विषय चयन किया है अत्यंत महत्वपूर्ण है। आज सोसाइटी का हर वर्ग, हर आयु वर्ग, हर लिंग वर्ग मानसिक रोगों से, स्ट्रेस से, लाइफस्टाइल रिलेटेड डिसऑर्डर से पीड़ित है और ऐसे में जहां कंटेम्पररी मेडिकल साइंस उस मार्गदर्शन नहीं दे पा रही है, उसमें हमारी आयुर्वेदिक जो विधा है चिकित्सा की, जो वर्षों से, शताब्दियों से, सहस्त्राब्दियों से मानव के स्वास्थ्य का संरक्षण करते आई है, इसके माध्यम से हम कैसे इन मानस रोगों का समाधान प्रस्तुत कर सकते हैं। तो थोड़ा सा हमें मूल में जाना पड़ेगा इस शीर्षक को समझने के साथ साथ। एक तो आयुर्वेद की मान्यता है कि हम इस शरीर और मन का खंड खंड चिंतन नहीं कर सकते। शरीर और मन अलग अलग नहीं है और इसलिए मानस व्याधियों, चाहे वो स्ट्रेस हो, अनिद्रा हो, चिंता हो, अन्य भी जो कुछ मानसिक रोग हैं, उनको हम अकेले मानस पटल पर नहीं देख सकते और इसीलिए हमारे योग शास्त्र में जो पंचकोश बताए हुए हैं उनका विचार भी हमको करना पड़ेगा। दर्शन में जिस प्रकार की ज्ञान धारा का उल्लेख किया गया है उसके आधार पर भी श्रीमद् भगवत गीता में भी जिस प्रकार से मन का उल्लेख किया गया है, उन सब संदर्भों को आज सामूहिक रूप देने की आवश्यकता है। तो चाहे वेद हो, उनके अनुवर्ती पुराण हो, उपनिषद हो या फिर समसामयिक संदर्भ ग्रंथ, इन सब में शरीर, मन, आत्मा और इंद्रिय, इनको समग्रता से विचार करते हुए मन के जितने किसी भी प्रकार के आवेग हैं, लोभ, शोक, भय, चिंता, क्रोध आदि जितने भी मानसिक आवेग हैं, उन सबको ध्यान में रखते हुए जब हम मानसिक व्याधियों का समाधान खोजेंगे तो तो आयुर्वेद और योग के माध्यम से ऐसा बहुत कुछ संभव है। हम ये मानकर चल रहे हैं कि आज ओपीडी में आने वाला जितना रोग भार है उसका 70% केवल लाइफस्टाइल रिलेटेड डिजीज के अंतर्गत ही आता है। तो ऐसे में इस 70% भार को हम करके एक तरह से राष्ट्रीय कार्य ही कर रहे हैं। आज किसी भी विधा के माध्यम से, खासतौर से आयुर्वेद और योग के माध्यम से, यदि हम देश के चिकित्सालयों पर लाइफस्टाइल रिलेटेड डिजीज के कारण जो बर्डन बढ़ते जा रहा है उसको हम थोड़ा बहुत भी कम कर देते हैं तो ये राष्ट्र सेवा भी है, राष्ट्र के आर्थिक उन्नति का आधार भी बनता है और मानव स्वास्थ्य के लिए एक की जाने वाली सेवा भी है। यह जो 2 दिन की सेमिनार अभी होने वाली है, इसमें बहुत से पार्टिसिपेंट्स ने इस मानस रोग, स्ट्रेस, चिंता इत्यादि के अलग अलग आयामों पर अपने अपने अनुभव, अपने अपने अध्ययन और अपने अपने शोध इसके माध्यम से पेपर्स को प्रेजेंट करेंगे। मुझे लगता है कि इन सब के परिणाम स्वरूप एक थीम पेपर हम तैयार कर पाएंगे और संसार को, विश्व को, देश के समाज को, सोसाइटी को हम कुछ कह पाने की स्थिति में होंगे कि आयुर्वेद और योग में मानस रोगों के समाधान के लिए जो कुछ भी बताया गया है उसको, जिसे हमने बुला दिया है, उसको सोसाइटी के, समाज के व्यवहार में फिर से स्थापित करने के लिए एक मार्गदर्शिका ये सेमिनार सिद्ध होगी। एक बार फिर से एक संक्षेप में इस भूमिका को आधार भूमि में वक्ताओं के सामने भी और हमारे श्रोताओं के सामने भी रखते हुए हमारे निवेदन पर अपने अपने व्यस्त समय में से भी निमंत्रित अतिथि वक्ताओं ने समय दिया है और हमारा मार्गदर्शन करने वाले उन सभी अतिथि वक्ताओं का मैं एक बार जेवीएन परिवार की ओर से हार्दिक स्वागत भी करता हूं और ये आभार भी मानता हूं और ये अपेक्षा भी करता हूं कि भविष्य में भी हम जब जब इस प्रकार के वैज्ञानिक और अकादमिक कार्य आयोजित करेंगे उन सब में आपकी इसी प्रकार से सक्रिय भूमिका और सहयोग हमको प्राप्त होता रहेगा। इतनी सी संक्षिप्त भूमिका के बाद अग्रिम आयोजन के लिए मैं डॉक्टर शिखा को समर्पित करता हूं। डॉक्टर शिखा। डॉक्टर शिखा, आप सुन पा रही हैं? डॉक्टर शिखा, ओवर टू यू।
सर, मैं किसी तरह से हेलो, एम आई
हाँ
ऑडिबल टू यू?
हाँ राघव, हाँ यस यस, हाँ आप सुनाई दे रहे हैं राघव जी। यस,
there are some technical issues going on, so somehow I got connected and let's wait others to connect.
Okay.
Yeah. I think they'll be connecting in few minutes. And thank you very much for your nice words. I heard it's always good to hear you. And let the conference be running. So it's now my turn to say a few words. So I am inviting myself to say a few words. Honorable Chairperson Ma'am, Honorable Advisor and CEO Vedant Garg Sir, Registrar Madam Hema Bafila, today's invited guest, our very own Pro-President Ayush, and all those who are connected with us in this conference, all the students, Dean and the Director, Faculty of Ayurvedic Science. First of all, I congratulate Faculty of Ayurvedic Science for warm opening of this 2-day international conference, Stress Relief and Lifestyle Disorders Management in Context of Vedas, today and tomorrow. In these 2 days, marathon sessions will happen. Lot of deliberations will be there. And to me, this is a very much needed topic. It is a needed topic in today's scenario, because what is happening today, lifestyle is changing, family structure is changing. We are actually globalizing. We are in a globalization phase, and there is also a lot of pressure to become digitally friendly. Our screen time has increased many folds, and we can observe these factors in our day-to-day life. There are a lot of other factors, and all these factors, all these happenings, actually what these things are doing, they are creating a lot of stress and lifestyle disorders. And as our Pro-President Ayush told, that these things may lead to anxiety, insomnia, lot of other type of, even in severe cases, depressions. And to me, Ayurveda and our Vedas, they can definitely play a significant role in managing stress and lifestyle disorders. And here I would like to give you an example. And before that, I would also like to say that there are ample opportunities. Tons of opportunities are available in this sector. If I give you the example of Harvard University run a course, run elective course, how to learn to be happy. And in a semester, more than 1,400 students enroll in that course. So if that course can be started, we can also made tailor-made modules how to improve our self-life, how to control the stress, especially using the Vedas. And this is the time now, because Ayurveda is popularizing at a very faster rate, and the government is bringing so many policies, so many other, our established people in the Ayurveda, they are doing a lot of efforts. So this is the right time. And institutions and universities, they can play a major role. And among students, we can, set this thing right from their student life, that how to manage the lifestyle. Because let me tell you, if we are becoming globalized, we have to face a lot of challenges. And this is the biggest challenge, how to keep ourselves ineffective by those changing factors, a race of development, a race of earning money, a race of good lifestyle. And I told so many factors in the beginning also. So at this point, I am very sure that in 2 days, we will get very good deliberations. And I wish all the best to Faculty of Ayurvedic Sciences and entire organizing team for success of this conference. That's all from my side. Thank you very much. Jai Hind, Jai Nari Shakti. Over to you, Shikha madam.
Thank you, sir. And sorry for the inconvenience due to bad weather conditions.
No issue. I continued. I found Kamlesh sir. He was just finishing his words. I
Yes,
got
sir,
connected and I continued because conference must run. So that's
Ji,
all.
sir,
Over
I
to
would
you,
like
sir.
to thank you, both of you together, sir, for holding the situation. So,
Thank you.
next, I would like to invite our first guest speaker, Dr. Kashinath Samkandi ji, from the Yoga and Swasthvrit Vibhag, NIA deemed to be university. Over to you, sir. I would like to add, I think all the speakers are soft speakers, but very strong academicians.
काशीनाथ जी जुड़े हुए हैं ना?
Yes, sir. Sir.
डॉक्टर काशीनाथ जी जुड़े हैं ना?
Yes, sir. Dr. Kashinath ji is connected. I think he is driving. He will. Sir, am I audible to you, sir? Vedic Kashinath ji, sir, am I audible to you?
Yes, we can hear you. We all can hear you. Please continue.
Okay, let me introduce about his theme. He will tell us about various lifestyle disorders and how to manage these lifestyle disorders with the help of yoga, naturopathy, and Ayurvedic practices like dietary regimen, following seasonal regimen, following Satvrit, following Achar Rasayan, which has been very well expressed in our old texts of Ayurveda. So he will soon deliver his lecture.
Request our pro-president Ayush that if he can, throw some light in few words that is it possible to start few modules how to improve the lifestyle based on Vedas? Is it possible or no?
Sure.
Sir,
Of course, निश्चित है.
स्पीकर ऐड हो
हाँ, जरूर. हाँ, एक बार जरा उनकी सिचुएशन पोजीशन देख लीजिए शिखा जी, नहीं तो मैं कंटिन्यू करूंगा.
जी सर, आप थोड़ा सा लाइफस्टाइल डिसऑर्डर्स का बहुत अच्छा इंट्रोडक्शन दे रहे थे.
हाँ, मैं दे देता हूँ, बिल्कुल दे देता हूँ. श्योर. ऑल द पार्टिसिपेंट्स, देखिए राघव साहब ने थोड़ा सा संकेत किया है. जब तक कि अगले वक्ता हमारे जुड़ पाए उससे पहले ये मानकर चलिए कि चाहे शारीरिक रोग हो या मानसिक रोग, दिनों दिन, और जो एक एक शेर आप सब लोगों ने सुना होगा कि मर्ज बढ़ता गया ज्यों ज्यों दवा की। संसार का मेडिकल एंड हेल्थ बजट बढ़ने के बावजूद भी रोगों की संख्या और रोगियों की संख्या कम नहीं हो रही है। और इसलिए अल्टीमेटली हमें अपनी इस भारतीय पुरातन चिकित्सा पद्धति की ओर आना ही पड़ेगा, जहां प्रकृति के साथ समन्वय रखते हुए अपनी जीवनचर्या को बनाए रखना। ऐसा यदि हम कर पाते हैं तो बहुत छोटी छोटी सी बातें हैं जिनको हम अपने जीवन में अपना करके न केवल शारीरिक अपितु मानसिक स्वास्थ्य को भी मेंटेन रख सकते हैं। उन छोटी छोटी बातों का साइंटिफिक वैलिडेशन भी संसार भर में हो रहा है, जिसका उदाहरण अभी अपने इंचार्ज प्रेसिडेंट राघव साहब ने भी दिया। सारा संसार इन छोटी छोटी बातों को लेकर के बहुत अवेयर होने लगा है। दुर्योग से अभी हम उस स्थिति में नहीं पहुंच पाए हैं कि हमारी ये जो ज्ञान संपदा है इसको अभी व्यवहार में हम ला नहीं पा रहे हैं। लेकिन छोटी छोटी बातें जो खान पान से संबंधित हैं, जो रहन सहन से संबंधित हैं, जो आचार विचार से संबंधित हैं, इन जिन बातों को हमने बुला दिया है, इनको अगर हम फिर से शामिल कर पाते हैं तो बहुत सी लाइफस्टाइल रिलेटेड डिजीज से हम बच पाते हैं। आप मानकर चलिए, इस बार भारत सरकार के अनुरोध पर विश्व स्वास्थ्य संगठन ने वर्ष 2023 को मिलेट ईयर घोषित किया है। इसके पीछे कारण क्या है, इसको हमें जरूर स्पष्ट कर लेना चाहिए कि पिछले कुछ दशकों से हमारे खान पान में जिस प्रकार का अंतर आया है और एक ग्लूटेन प्रभावी या यूं कहें कि कार्बोहाइड्रेट प्रभावी अत्यधिक भोजन होने के कारण बहुत सी लाइफस्टाइल रिलेटेड आज संसार फेस कर रहा है। उनमें हाइपरटेंशन है, डायबिटीज है, थायराइड है, पीसीओडी, पीसीओएस है, अनेक प्रकार के मेंटल स्ट्रेस जैसे रोग हैं। तो उनमें एक बड़ा कारण जो समझ में आ रहा लाइफस्टाइल रिलेटेड हमारे खान पान के विषय में है, और इस चीज को रेखांकित किया, अंडरलाइन किया विश्व स्वास्थ्य संगठन ने भी। और इस वर्ष को उन्होंने पोषण वर्ष के रूप में भी और मिलेट्स को प्रस्थापित करने के लिए भी। तो आज सामान्य जन की थाली में से मिलेट्स गायब हो चुके थे, ऐसे श्री धान्य को स्थापित करके बहुत से ऐसे न्यूट्रिएंट्स जो हमें डाइट के माध्यम से नेचुरली मिल सकते हैं, उनकी प्राप्ति का एक उपाय मिलेट्स का रेगुलरली कंजम्पशन। सारे संसार भर में मिलेट्स फैले हुए हैं, खासतौर से साउथ एशिया और उसमें भी भारत जैसा देश मिलेट्स का बड़ा उत्पादक देश है। और अन्य देशों के साथ कुछ अन्य देश में जहां मिलेट्स की प्रचुर मात्रा में उत्पादन होता है, परंतु अच्छी बात यह है कि मिलेट्स की जो यील्ड है प्रति उत्पादन क्षेत्र भारत में सर्वाधिक होने के कारण हमको सहजता से उपलब्ध है। ऐसे में बहुत से ऐसे डेफिशिएंट डिजीज जो कुपोषण के कारण हो रही हैं, बहुत से माइक्रो न्यूट्रिएंट्स हम नहीं ले पाते हैं, वो केवल अपनी थाली में मिलेट्स जो अपना लोकल धान्य है इनको अगर शामिल कर पाते हैं तो उससे हम बहुत सी बीमारियों से खान पान के माध्यम से बच सकते हैं। खासतौर जब मानस भाव का हम जब विचार करते हैं तो वैदिक परंपरा के अनुसार आयुर्वेद दो बातों पर फोकस करता है। वो ये कहता है कि हमारे बहुत से ऐसे अर्जेज हैं, धारणीय वेग हैं, अधारणीय वेग हैं, जिनको हम धारण नहीं करना चाहिए उनको धारण कर लेते हैं काम के दबाव में, उपेक्षा के कारण, विचार नहीं होने के कारण, मालूम नहीं होने के कारण। तो जो धारणीय वेग हैं उनका हम धारण करें तो ये सारे के सारे मन से संबंधित हैं। और उन मन से संबंधित बातों को उन्होंने बड़े अच्छे ढंग से वैदिक आधार लेते हुए आदरणीय चरक आचार्य जो उन्होंने कहा कि लोभ, शोक, भय, क्रोध, अभिमान, चिंता, उद्वेग इत्यादि मानसिक भाव सहज रूप से आते हैं, उनको नियंत्रित करके रखने की आवश्यकता है। ये सारे के सारे मानस भाव, मानस आवेग मानस रोगों के आगे जाकर कारण बनते हैं। तो ऐसे जिनको हम मेंटल इमोशंस कहते हैं, इन इमोशंस के ऊपर नियंत्रण करना, यही बात श्रीमद् भगवत गीता में श्री कृष्ण भी कहते हैं अर्जुन से कि सब समस्याओं का जड़ मन है। इसलिए मन को अगर हम नियंत्रित कर लेते हैं, इन मेंटल इमोशंस को एक पॉजिटिव वे में रखकर हम चलते हैं तो हम बहुत से मानसिक विकारों से बच पाते हैं। आज समस्या यही है कि मैं जितना हकदार हूं उसे कहीं अधिक पाने की लालसा है। मैं अपने प्रतिकूल थोड़ी सी भी बात होती है तो उसको स्वीकार करने की स्थिति में नहीं हूं। मेरा किसी भी इंडिविजुअल का टेम्परामेंट धीरे धीरे लूज होने लगा है। छोटी सी बात को लेकर के एक तनाव, इरिटेशन जो आता है उस कारण से बहुत सी समस्याओं का, बहुत सी वैयक्तिक समस्याओं का, बहुत सी सामाजिक समस्याओं का और बहुत सी राष्ट्रीय समस्याओं का उत्पादन इन सब कारणों से होता है। तो धारणीय वेगों का धारण एक बेसिक चीज सामान्य व्यक्ति के लिए भी आवश्यक है कि अपने मेंटल इमोशंस पर वो नियंत्रण रखे। जब अर्जुन ने कहा कि इस मन को तो नियंत्रित करना बहुत मुश्किल है, तब उसका समाधान भी भगवान श्री कृष्ण बता देते हैं कि निरंतर अभ्यास और वैराग्य, वस्तुओं के प्रति मोह नहीं रखना, मुझे जितना मिला है उसमें संतोष रखना, उससे अधिक की लालसा नहीं करना, जो मेरा नहीं है उसके प्रति लालायित नहीं रहना। ऐसी छोटी छोटी बातों को अगर हम जीवन में अपना पाते हैं तो हम बहुत से मानसिक विकारों से दूर हो सकते हैं। ये जो समस्या है वो कोई केवल विशेष आयु वर्ग की ही नहीं है, ये बचपन से लेकर वृद्धावस्था तक, ये जेंडर, ये देश में, यानी देश काल निरपेक्ष, किसी भी समय में, किसी भी आयु वर्ग में, किसी भी देश में, किसी भी क्षेत्र में, सब जगह आज जो है व्याप पड़ता जा रहा है। तो उससे संबंधित जितने भी मानसिक आवेग हैं उन पर थोड़ा सा नियंत्रण हम रख पाते हैं। इसका आयुर्वेद बहुत अच्छा सा मार्गदर्शन करता है, उसमें सहयोग करता है योग भी। जब अष्टांग योग के जो पहले दो उपक्रम हैं, अहिंसा, सत्य, अस्तेय, ब्रह्मचर्य, अपरिग्रह, यम, नियम, शौच, संतोष इत्यादि का पालन यदि कोई व्यक्ति नियम पूर्वक करता है तो स्वाभाविक रूप से होने वाली इन मानसिक व्याधियों से वह बचा हुआ रह सकता है। तो जो तीन मोटी मोटी बातें प्राय आयुर्वेद के माध्यम से हम लोगों को मैसेज देते हैं कि अपने खान पान में, अपने रहन सहन में और अपने आचार विचार में अगर हम फोकस करते हैं और अपने परंपरा से जो चीजें चली आई हैं ठीक प्रकार से हम फॉलो करते हैं, यदि उनका हम पालन करते रहेंगे तो हम इन सब व्याधि से बच सकते हैं। तो ऐसी स्थिति में सब बातों को ध्यान में रखते हुए अपनाते हैं यदि, तो ये छोटी छोटी बातें, एक बहुत बड़ा वर्ग आचार रसायन का, जिसका उल्लेख अभी शिखा मैडम ने भी किया। आचार रसायन केवल इतना सा है कि हमारे डूज एंड डोंट्स क्या हैं, इंडिविजुअली मुझे क्या करना चाहिए, क्या नहीं करना चाहिए, एज ए ह्यूमन बीइंग, एज ए परिवार का सदस्य, एक समाज का इकाई होने के नाते, एक राष्ट्र की इकाई होने के नाते मेरी क्या भूमिका हो सकती है, क्या मेरे लिए करणीय है, क्या मेरे लिए अकरणीय है। इस डूज एंड डोंट्स का मुझे यदि ध्यान रहता है तो मैं न केवल वैयक्तिक मानसिक स्वास्थ्य, समाज के मानसिक स्वास्थ्य को भी, फलतः राष्ट्र और विश्व के मानसिक स्वास्थ्य को भी मैं समाधान दे सकता हूं। इसलिए आज इंडिविजुअल अपने मन के अंदर जो द्वंद्व है, वहां से लेकर के संसार के पटल पर दो बड़े देशों के बीच चल रहे द्वंद्व का भी समाधान इस मार्ग से हमको मिल सकता है। तो कुछ संक्षेप में बातें मैंने रखी हैं। शिखा जी, जैसे काशीनाथ जी जुड़ जाएं मुझे आप संकेत कर दीजिए। तो इन सब बातों को हम अपने जीवन में यदि अपना पाते हैं तो जब मानस रोगों की हम बातचीत करते हैं तो उसमें योग का भी हमको सहयोग मिलता है। जब हम अपनी लालसाओं पर नियंत्रण, हाँ जी
सर,
काशीनाथ जी जुड़ रहे हैं?
yes sir, sorry to interrupt you sir. Kashinath ji sir is
हेलो।
yes sir.
हाँ,
ऐड हो रहे हैं, आप अपना
हो, वेलकम वेलकम।
Yes.
हाँ जी sir. Okay. Now I would like to request our first guest speaker, Vede Kashinath ji Samkandi from NIA Deemed to be University. Sir, you may join. Kindly unmute, sir. I think the space is not enough. Technical team, kindly try to connect.
उनको जरा एक बार कॉल करके पूछ लीजिए क्या क्वेश्चन। हाँ कोई, हाँ
Yes sir.
उनको कुछ कठिनाई तो नहीं हो रही है?
जी sir.
जबकि डॉक्टर काशीनाथ जी तो स्वयं भी टेक्निकली बहुत साउंड है, आधुनिक इन विधाओं के भी बहुत अच्छे जानकार हैं, फिर कैसे क्या कठिनाई हो रही है उनको? डॉक्टर शिखा जी, अगर उनको कठिनाई हो रही है और दूसरे वक्ता यदि अपने पटल पर उपलब्ध हो तो हम उनसे भी रिक्वेस्ट कर सकते हैं ताकि समय का सदुपयोग हो।
Sir, he is there, but he is unable to join because lot of speakers are there. I am trying to connect with the technical team. मैं technical team से request करती हूँ।
हाँ देखिए, हाँ एक बार करिए।
जी सर।
हाँ कि जरा उनका काशीनाथ जी का स्टेटस देखें।
जी सर। एक बार इस बीच मैं इंट्रोड्यूस करवा देती हूँ हमारे कुछ गेस्ट स्पीकर्स। डॉक्टर दीपमाला यादव will be with us in tomorrow's session, and Dr. Ramteet Sharma ji will also be with us. I welcome you today, sir. Dr. Abhishek Sharma ji is having his next lecture, and Dr. Vishwavasu God ji will join us in post-lunch session. So I think here it is now enough space.
हेलो।
हाँ काशीनाथ जी, आप जुड़ नहीं पा रहे हो?
हाँ सर, ये आ रहा है कि स्टूडियो फुल।
शिखा जी जरा टेक्निकल टीम को बोलिए, उनको मैसेज आ रहा है कि स्टूडियो इज फुल। तो गेस्ट के नाते आप गेस्ट वाली जो लिंक है उसी से जुड़ रहे हैं ना काशीनाथ जी?
जी जी सर।
हाँ, तो जरा टेक्निकल टीम को बोलिए कि उनको एंट्री दें।
Yes, sir. Yes, sir.
जुड़ गए, वेरी गुड, वेलकम, स्वागत, जुड़ गए तो है ना? हाँ, अच्छी बात।
आवाज आ रही है सर मेरा?
हाँ, स्वागत है काशीनाथ जी।
Namaste, sir.
नमस्ते मैम।
Namaste,
नमस्ते
sir.
मैम।
Very
आवाज
warm
आ रही है?
welcome to you, sir.
जी
Ji, sir, you can start your lecture, sir.
ओके, अलाउ मी टू
We
शेयर माय
welcome
स्क्रीन।
you. Yes, sir. Over to you, sir.
या let me know when my screen will start sharing.
Yes, sir. Okay.
I presume it's sharing now.
Yes, sir. Okay.
Can I start?
Yes, sir.
गुणत्रय विभेदेन मूर्तित्रयं उपयुषे त्रयवेत नेत्रय लोके पतये नमः। सरस्वतीं नमो यस्यै प्रसादात् पुण्यकर्मैः बुद्धिदर्पणं संक्रान्तं जगदाध्यक्षे अभिक्षे ब्रह्मदक्षे अक्ष्मदेवेषु भारद्वजं पुनर्वशु हुताशुवेशे चरक प्रवृत्तभ्यो नमो नमः। पाताञ्जलिं महाभाष्य चरक प्रतिसंस्कृतं मनोवाक्काय दोषाणाम् अर्त्यायिपते नमः। Good morning everyone, and respected my guru Vaidya Kamlesh Kumar Sharma sir, and Dr. Shikaji, and all the faculties of university. So it's my privilege to present the topic on Ayurveda way of living in stress management. So as we all know that stress has become the inevitable part of modern lifestyle. It won't be wrong if I say that it has become the unwanted companion of today's lifestyle. In each and every aspect of our activities, one or other way, stress is involved. But saying stress as a bad always is not supposed to be accepted, because stress is need. Because to do any activity, ultimately you need to have a stress, because Ayurveda and even other Siddhanta says that alasya hi manushyanam sharirastha mahana ripu. So if you are in this state of in the state of any inability to do any work, or if you are in a state of lethargy, then obviously you can't do any kind of work. So if you want to be active, ultimately there should be a stress. So if you have stress, then you will be able to achieve certain goals. But which kind of stress and how long you are going to expose to the particular stress, that matters. If you expose to any kind of stress for a short duration, then obviously it is going to help you lot in achieving lot of the things. Same stress, if you expose repeatedly for longer time, then obviously particular stress is going to affect your body adversely. It may give rise to the lots of ailments related to the body, somatic diseases. It may give rise to the even psychological diseases, or even psychosomatic disorders. So stress is needed, but how we need to accept and in which amount we are supposed to expose to the stress is very much important. So we all know that eustress, there are two classification of stress. That is, one is eustress, another is distress. Eustress always give the fruitful result. Contrast to this is the distress, which is going to affect your body adversely. So whenever you are exposing to the any kind of stress, even though if it is a eustress, if eustress is continuous and long standing, same eustress may convert in the form of distress. So we need to expose to the stress. After completion of your goal, after achieving your goal, again you need to come back and you need to calm down yourself. Otherwise, same stress is going to affect your body adversely. So when we say about stress, always we are not supposed to think that it is only related to the psychological factor. It is only the psychological part, because stress is even we are getting from physical part. Suppose if you are doing any physical activity more than the requirement, then again that physical activity may cause stress to your body. If you are suffering from any kind of diseases, if you are not able to control particular diseases, if it is running long term, same disease may act as a stress to your body. In the same way, there are lots of environmental factor regularly we are exposing. It may be like noise pollution, or it may be like air pollution, water pollution. Repeated exposure to these kind of pollutants, again these pollutants are going to act as a stress. So here in my talk today, I am going to focus much on psychological stress and how to combat psychological stress with the help of Ayurveda and Yoga Shastra. So before we discuss about stress in detail, just I would like to give very brief introduction regarding the stress and its definition. In simple way, if I want to say stress is nothing but the any kind of stimuli which will triggers the physiological and pathological changes in the body through complex emotional effects on the body. So any kind of stimuli which vitiate the physiology and pathology of the body is considered as the stress. Again, whenever there is a stimuli, our body also respond. It may respond in the form of fight or a flight response. So if your body respond as a fight, then obviously you can combat this stress. If your body respond as a flight, then that may affect your body in the term of distress. So ultimately, stress is nothing but the stimuli which will trigger the lots of changes related to the physiology and pathological changes. So nowadays people are exposed to the lots of stress, and what is the main cause of stress? Ultimately, expectancy. Life expectancy is more, and even demand of the particular era is more, because in the pursuit of earning the prosperity, in the pursuit of earning the wealth, people are exposed to the lot of stress. They are working lot, even like without any timeline. People are working lot, even in night out, even the ratri jagarana people are doing. Because of these kind of work culture, people are exposed to the lot of stress. And along with that, again, there are lots of events which are occurring in in the public domain, like it may be the marriages, it may be the divorce, pregnancy, and even abortions, illness, and bills. It may be bill of like it may be telephone bill, or it may be any bill. And these are, and even there are expectations from the lots of colleges, universities, because of these excessive demands, because of these competitive era, people are exposing to lots of stress. And even another very important factor or cause for this stress is the staying in disorganized manner, because we won't plan anything. Without any planning, we will jump into the particular task. If there is no any plan, if there is no any systematic agenda, then obviously that disorganized activities will again put lots of stress. Always we need to plan out. Suppose if you get any task, we need to plan out how we need to proceed and how we need to achieve particular task. If there is no any systematic plan, obviously that disorganized thing will cause a stress to your body. And another very important is physical constraints, especially that nowadays people, because of technology, because of this urbanization, most of the people are they are acting as a like sedentary, because of very less physical activity or no physical activity. Because of these things, again, people are falling victim for the stress like condition. These are some of the basic causes for the stress. Again, coming to the classification of the stress, as I stated earlier, there are two types of stress. One is eustress, another is distress. Eustress, it can be considered as the positive stress, that is, the outcome of this kind of stress will be always positive, whereas distress is that the outcome of distress will be always negative. It may affect your psychological status or it may affect your physiological status, and this is considered as the negative stress. So in very brief way, when the person exposed to the any eustress, that is positive stress, it will help to increase the concentration, it will increase the work efficiency, performance, and even it will invigorate the energy in the body, and because of these things, person will achieve his goal without any complications. This is called as a positive stress or eustress. Contrast to that is called as a negative stress, where because of exposure to the distress or negative stress, the person will lose the motivational factor in the body, and even he will there will be reduction in the effectiveness in all the work what he is executing, and even because of this, even there will be lots of variation in the physical, mental, and behavior factors. Because of this, again, person will end up with the lots of psychological ailments. Coming to the how exactly stress is going to affect your body, this is the one of the a pathological effect impact of stress on the body. How exactly repeated exposure to the any kind of stress, how the person will suffer with the diseases related to the blood pressure, diseases related to the metabolic disorders like diabetes, PCOD, or it may be hypothyroidism. So this is the one of the major accepted pathway how exactly stress is going to affect your body. So when person exposes to the stress, ultimately it activates or it sends the signal to the hypothalamus, from their pituitary, from their adrenal gush will be there, adrenal hormonal gush will be there. Because of that, corticosteroids, everything will be excessively secreted in the body. Because of this catecholamine, excessive secretion of this catecholamine will leads to the variation in the blood pressure, pulse, respiration rate. Even it will affect the central nervous system, and even it is going to affect your metabolism. Once your digestion, metabolism is affected, ultimately it is going to affect your body adversely. As we all know that Ayurveda says that rogaha sarve api mandagnam. So ultimately when these are affected, when these chain is affecting the metabolism, mandagni like condition will give rise to lots of ailments. So this is the one of the well accepted pathway how exactly stress is going to affect your body and how it is going to affect your metabolism. Not only the metabolism, even once if your metabolism is vitiated, even it is going to affect your immune system. Even it is going to affect your all the vital functions of all the vital organs of your body. And because of this, person will be victim for various diseases, starting from blood pressure to the anxiety, blood pressure to diabetes, PCOD. These are some of the complications what we are getting from the repeated exposure to the stress. Again, as I stated, whenever the person exposed to the stress, it is not that every person is going to end up with the diseases. Again, it will depends upon the capacity of the person, how he is going to cope up with the stress. So whenever the person exposed to the stress, ultimately there will be some alarming reactions, like there will be increase of the heart rate, pulse rate, breathing, and even there will be spasm in the muscles. When the person will start getting these symptoms, these are some of the alarming symptoms. At that time, person should understand his own body, then he should remain away from such kind of stress which is making the person to get these symptoms again and again. If person doesn't understand this situation, again, if he continuously go on working hard or working more, even after getting these symptoms, then the person will enter into the stage of resistance. From there, he will enter into the stage called a stage of exhaustion. When the person enter into the state of exhaustion, then person will start giving the ailments or diseases related to the mind. So consequence of stress here again, as I stated, stress not only going to affect your physical body, even it is going to affect your psychological part, and even it's going to affect your behavioral part of the body. So physiologically, what are the changes we presume, or we are going to see when the person is exposing to the any kind of stress is headache, repeated headache, high blood pressure, high pulse rate, increased respiration rate. These are some of the physiological entity what you can see when the person exposed to the stress. And again, when this stress is continuous, then psychological changes will start happening, like person will be anxious, anxiety like complaints, depression like complaint. And even if he is working in any job, obviously there will be dissatisfaction in this particular job, and behavioral changes, like he will be victim of absenteeism, and even he may fall victim for certain ill habits like drug abuse, alcoholism, or even like smoking. So these are some of the behavioral changes what person may expose us when the person exposed to the stress continuously. These are some of the changes, physical, psychological, and even behavioral changes seen in the particular person. And symptoms, when we say the person is exposed to the stress, these are the common symptoms what we are going to see. These symptoms are for long run. If it is not for like a very short duration, but it is running for months together, if it is running for years together, then it indicates that the person is the victim of stress. Like it may be like it may be a partial headache, or any kind of headache, or nervous stomach, anger, depression. These are the usual symptoms where the person is going to feel. And along with that, even the person will have the conditions like insomnia, that is loss of sleep or disturbed sleep. Along with that, he will be having the problems like emotional problems, and even all these skeletal problems like neck pain, back pain, migraine. So these are some of the symptoms. And very rarest to rare case, even people will have the tendency of suicidal. So these are some of the symptoms what we are going to see when the person is exposed to the distress. So coming to the Ayurveda, these are some of the modern point why I tried to explain the things in very brief way. Ayurveda, how exactly takes the concept of stress. We all know that in Ayurveda, we get the reference like Sahasa, Shrama, Klama, Ayasa. So these are these are nothing but these are some of these specific terminologies which are related to the stress. And even Ayurveda says that Kalartha Karmanam Yoga Ina Ati Mitya Matraka. That is excessive or the Mitya Yoga or Ati Yoga of the Artha and Karma and Kala. These are some of the main etiology for all kind of diseases. Even when we think about the stress, again, Ati Yoga of Artha, Ati Yoga of Karma, or Mithya Yoga of Artha, or Mithya Yoga of Karma, that is Indriya and Artha, Mithya Yoga or Ati Yoga will leads to the psychological diseases like stress. And even another very important part is Ayurveda. In many contexts, it has been stated that we need to do Atma Avalokana. If you don't analyze your mind and body regularly, then again that not assessing or not doing Atma Avalokana make you to fall prey for the stress like complaint. And if suppose if you are already suffering with any kind of Mansika Vikaras, again that Mansika Vikara in turn, again it is going to produce the stress-like condition. So ultimately, the terminology is what we are going to get in Ayurveda, like Sahasa, Shrama, Klama, Ayasa. So again, somewhere they are referring to the concept of stress. So here again, what are the factors inflict the conditions like stress according to the Ayurveda Siddhanta? If you want to analyze, so psychological factor, that is non-observance of Achar Rasayana, because Ayurveda always says that Samadosha, Samagnishta, Samadhatu Malakriya, Prasannatmendri Manaswastha Ityavadiyate. That is, if you want to say, if you want to say a particular person is healthy, he should be physically healthy, and he should be psychologically healthy. That is, he should be Samadosha, Samagnishta, Samadhatu Malakriya, Prasanna Atma Indriya. It indicates that even the person should be psychologically, he should be healthy. Prasanna Atma Indriya. If person doesn't has, then the person is not considered as healthy. To maintain the samatva of Indriya, Mana and Atma, ultimately person should follow the rituals which are explained under the heading of Achar Rasayana, Sadvruta, Dharaniya Vega. So if the person doesn't observe, doesn't accept these factors, then again he will be the victim for the psychological stress. In the same way, in ahara factor, because Ayurveda says that annam vritti karanam sreshtam, so it is the one of the survival factor. Even by the anna, even the person can attain the psychological health, especially tushti pushtir, like tushti pushtir balar medam sarvamannam pratishtita, tushti pushti varna prasada swashirya jivitam pratibasukam, everything will comes because of ahara, and especially food which are vitiating the vata and pitta dosha or have more tendency to vitiate the raja and tamaguna of the mind. If raja and tamaguna of the mind are vitiated by excessive intake of vatakara and pittakara ahara, then obviously psychology of the person is vitiated. And even in Bhagavad Gita, we all know that in Bhagavad Gita it has been mentioned that satvika ahara will help to support the psychological part of the body. If the person fall victim for the tamasika and rajasika aharas, again it is going to affect the tamasa guna and rajasa guna of the mind, and leads to the psychological diseases. And again, vihara, because most of the time we think that only ahara is going to affect your body. Parallel to the ahara, even viharas are also very important. If you excessively get involved in the excessive physical activity, adhika atyadika vyayama, atyadika vihara, ratri jagarana, so and even vega dharana, these are some of the viharas. One or other way it is going to affect the vata and pitta dosha. Once vata and pitta dosha are affected, it is going to affect the tama and raja dosha of the mana, which in turn leads to the psychological diseases. So coming to the aharaja karanas, very briefly I would like to explain that how exactly aharaja karana is going to give rise to the stress-like condition. Ayurveda says that ruksha shito katur lagu. The person, when person excessively intake the ruksha, shita, katu, lagu aharas, and shushka shaka, vallura varaka, shushka shaka, that is dry vegetables. Nowadays people have the practice of drinking the vegetable juices without cooking. So if you drink or if you take the vegetables without cooking, then that will comes under the category of shushka shaka. Shushka shaka, vallura, that is dry meat, excessive intake of dry meat. Shushka shaka, vallura, varaka, uddalaka, koradosha. So these are some of the pulses, even like mudga, masura, adaki, chanaka, so harenu. These are some of the pulses and millets. Excessive intake of pulses, excessive intake of millets, again it is going to affect your vata dosha, and along with that other factors which are related to the ahara is that anashana, vishmashana, adhyashana. So improper taking the food, untimely intaking and excessive intake, quantity wise excessively intaking the food, again these are some of the factors which are going to affect your vata dosha. Because of this, person will show the certain symptoms like dehydration, that is decrease in the hydration in the skin. So first of all, when the person exposed to the any kind of stress, you can see the dryness of the skin, color and discoloration of the skin, and even it may leads to the increase of the viscosity of the blood and fluid, and again it is the symptoms which indicates that there is an increase of the vata dosha, improper digestion, metabolism, that is because of vishamashana. So like this vata vikaras will go on occurring. Again, this indicates that person is in the conditions like stress. So just as I stated that drinking these vegetables without any cooking will leads to the vata dosha prakopa, and intake of shushka shakas, that is dried vegetables, shushka mamsa, vallura, that is intake of these dried things. Nowadays these are trending. Excessive intake of these things will vitiate the vata dosha. And another factor which is vitiating the pitta dosha, if you take the ahara and vihara which vitiate the pitta dosha, again it is going to affect your body, especially intake of katu, amla, lavana, ati ushna, vidahi. Katwamla lavana, atyushna, vidahi. Lagu ahara if you take, again it is going to vitiate the pitta dosha. And especially choosing the oil in Rajasthan, many people are having the habit of taking this sarshapa taila, but sarshapa taila is directly vitiate the pitta dosha. If already person is suffering from any pittaja vikara, or if the person is suffering from any psychological disorders where there is the involvement of rajoguna, and if the person belonging to the pitta prakriti, then they are not supposed to take excessive amount of tilataila, atasi and sarshapa taila excessively. Tilataila, atasi and sarshapa taila, again it is going to vitiate the pitta dosha. And all intake of all spices pippali, lavanga. These are some of the condiments. If you take excessive amount of these condiments and excessive intake of all non-vegetarian, again it is going to vitiate the pitta dosha, which in turn going to vitiate the rajoguna. In the same way, excessive intake of dadi, takra kurchaka, all dadi, that is curd made food items, again it is going to affect the pitta dosha, because we all know that Ayurveda says that curd, that is dadi, is of ushna virya. Because of ushna virya, again abhishanti guna, it is going to affect the pitta dosha affected will vitiate the rajoguna. And intake of all amla rasa pradhana ahara, especially phala, excessive intake of sour fruits will again going to affect your pitta dosha. So when pitta dosha is affected, all rajoguna will be affected. When rajo doshas or mansika doshas are vitiated, the person will be victim of hypertension, anxiety, irritability, anger, hypermetabolism, acid peptic ulcer. Like again, these are the some of the outcome of pitta dosha. So again, nowadays, why I highlighted these food, because nowadays we have the habit of taking vidahi ahara excessively, but we don't know which kind of vidahi aharas we are taking. If you are taking the Indian bread or rotis, if it is like excessively burnt, again it is a vidahi ahara. If you take the papad, if it is excessively burnt, again, and people have the habit of taking these what we call maize, like cooked maize, maize. Again, this is also a, like. Pitta Javikara. And barbecue. People have the trending of going to the barbecues and having the barbecue prepared food. Again, these are nothing but the vidahi annas. Excessive intake, these will leads to the vitiation of the rajadosha. Raja dosha. So in such a way, any aharas which is going to affect your vata and pitta dosha, in turn it is going to affect your psychological part. And coming to the viharas, again there are certain viharas which are going to affect your vata dosha. That is balavat vigraha, vyavaya vyayama, adhyayana, prapatana, prapidana, pradhavana, langana, ratri jagarana, baraharana. So these are the some of the activities, and even vega dharanas. These are the some of the viharas which are going to affect your vata dosha. Again, suppression and repression, that is vega dharana or vega udhirana, again it is going to affect your vata dosha. And again, pitta dosha, krodha, shoka, bhaya, yasa, upavasa, vidagdha, maitanoupagamanam. That is krodha, shoka, and bhaya. These are the some of the psychological factor. If you expose regularly, repeatedly to these psychological factor, it is going to affect your pitta dosha. Once if your pitta dosha is affected, ultimately it is going to affect your even raja dosha of the mana. So once if the person exposed to these etiological factor, then person will start showing the certain symptoms related to the stress. So how to assess that person already fallen victim for the stress like condition? So these are the some of the tools which will help to assess the stress like conditions. So there are validated scales. You can use the validated scales like Holmes and Rahe stress scale, which will help to assess the stress exposure. Along with that, galvanic skin response. We all know that whenever we are exposed to the stress, there will be excessive sweating, perspiration. So to assess the skin hydration, to assess the moisture of the skin, this galvanic skin response will help to make out whether the person is exposed to the stress or not. Again, blood pressure, sphygmomanometer will help to assess the blood pressure, and digital thermometer, because whenever you exposed to the any kind of stress, even the temperature of the skin will go on varying. If there is a repeated variation in the skin temperature, again it indicates person is exposed to the stress. Polysomnography, even this is the one of the modern technology which will help to assess each and every organs. It will help to assess the movement of the eye, it will help to assess the heartbeat, it will help to assess the muscle compactness, everything. So this also helps to assess the stress. And EEG, electroencephalogram. So these are the some of the tools modern in modern technology people are using to assess the stress. So coming to the how to manage the stress on the basis of Ayurveda, because Ayurveda says that we need to plan the day and night. As I stated earlier, that being in the state of disorganization is the one of the cause of stress. But so if you want to be organized, then you need to do the Atma Avalokana, that is, you need to plan your day and night. Ayurveda says that Naktam Dinani Meyantyam Katabhutasya Samprati Dukkha Bangna Bhavatyam Nitya Sannihiti Prata. That is Naktam Dinani Meyantam. At the end of the night, you need to assess what are the good things you done, what are the bad things you did, and what are the bad things created the stress in your body. If you go on analyzing at the night every day, so that will help to make out which are the stress component you are exposing, and you can remain away from such a stress component. So even you can make out even you can plan the day and night. And even you know that while explaining the Brahma Muhurta, Ayurveda says that Sharira Chintam Nirvartante Kruta Shauchadi Vidistata. Ayurveda says that you need to make the Chintana of the Sharira. After that, you need to go for evacuation of the bowels. But Sharira Chintana, it not only refers to that you need to assess your bowel or you need to assess your digestion, even it make you to understand the concept of planning the day and night. That is, before you are leaving your home, you need to plan out what all the things should be done in your professional life. So if you plan, if you make a diary and if you make a note of these things, again, there is a less chance of falling prey for the stress like complaint. And along with that, again, there are different modalities which are explained in Ayurveda to combat this stress like condition is Dinacharya, Sadvrutta, and Ritucharya, seasonal regimen, and appropriate intake of sleep. Very briefly, I am going to explain these things. Brahma Muhurta. So Ayurveda always says that Brahma Muhurta Jagarana. So purpose of advising Brahma Muhurta Jagarana is that so when person get up in the Brahma Muhurta, that is 96 minutes before the sunrise, so the person will get the sense of positiveness, sense of positivity. That sense of positivity will helps to tackle or calm down your mind. It will helps to take out the stress like condition. So Brahma Murte Uttishte Jirna Nirupayam. So purpose of making the person to get in Brahmi Murta is that it gives the sense of positivity. Even environment will be totally less in all the pollution, less in all the variations. That is the reason Brahma Murta is suitable time to get up to combat this stress like condition. And Pratimarshanasya, because Ayurveda says that Dinante Pratimarshanasya Shroto Vishodanam Sukha Sopna Prabodhanam. Because if you go for practicing the Pratimarshanasya in the evening, this will helps to keep your mind calm, and even it will induce us the Sukha Sopna Prabodhanam. If you get a good sleep, again it will helps to combat the stress like condition. And Vyayama, because Ayurveda says that Sharira Ayasa Jananam Vyayamam. But here, Vyayama is supposed to be considered in such a way that Ayamo Vividanganam Vyayama. Any activity in which there is an involvement of each and every body parts, that activity is called as a Vyayama. Such kind of Vyayama you need to indulge. If you indulge in the Vyayama, then obviously that Vyayama will helps to control your mind, because in Yoga Shastra it has been stated that Chale Vatam, Chale Chittam, Nishchalet Bhavet. Your Chitta, your mind is going to get fluctuate on the basis of your breathing pattern. So if you want to control your breathing, you need to control your body. So if you want to control your body, you need to have the habit of performing the Vyayama regularly. So Vyayama will helps to control your mind, body. And Abhyanga. So Ayurveda says that Abhyangam Acharit Nityam Sa Jara Shramavataha. As I stated, Shrama is nothing but it's a synonym to the stress. So if you want to reduce the stress like condition, make the person to practice Abhyanga regularly. Abhyanga is nothing but oil massage. You can take the Kshirabala Taila, Mahanarayana Taila, Abhyangam Acharit Nityam. Suppose if you don't have sufficient time to practice Abhyanga, at that time you can advise at least Shiras Shravana Padeshu Visheshena Shele. Regularly, if you get involved in the massaging the head, foot and ear with the oil, that will also helps to get the advantage of the Abhyanga. So Abhyanga in turn will help to control the complaints of Shrama, that is stress like complaints are reduced. Utsadana, we all know that there are two methodologies. One is Udgarshana and another is Utsadana. Utsadana is nothing but oil paste massage. Oil paste massage again helps to take out the all Vata dosha from the skin. Once Vata is controlled, ultimately even Rajoguna of the mind is controlled. Snana, again every day we need to take the bath. But if the person is the victim of stress, make the person to take twice daily bath. That is Dvaikalam Upasprishyati. Pratah Sayam. Dvaikalam Upasprishyati. Twice a day taking bath will again helps to control the mind. So psychological factor of the mind can be controlled if the person has the habit of twice a day snana and vastra dharana. So again, why I am saying about the vastra dharana again, if you have the habit of wearing regularly clean and tidy clothes regularly, even it will give the sense of positivity, sense of confidence. If sense of positivity and confidence is there, again you can easily combat the stress like conditions. And again, Ayurveda says that mana prasanna gandha shabda samvananicha. If you want to get the good sleep, you need to have mana prasanna gandha, mana prasanna shabda and samvana. That is you need to before going to bed, you need to like inhale very fragrant fragrant odor should be inhaled. Manaprasanna fragrant odor will give the good sleep to your body. Manaprasanna gandha, manaprasanna shabda, that is listening the music at the night, again very cozy, very soothing music. If you hear during the bedtime, again it will also induce us the good sleep. What we say nowadays, music therapy. So this is the concept of Ayurveda. Manaprasanna gandha shabda samvani. Ratnabharana dharana, again wearing of the all the gems, again gemstones, again it will give the sense of positivity. And coming to the ahara, to tackle the vata dosha and pitta dosha, as I stated, always we need to take the food which have the tendency to maintain the samatva of dosha and dhatu, especially all the food which are mentioned in the context of nitya sevaniya ahara, that is Shiliya Chali Goduma, Yavashashtika Jangala, Sunishanika Jivanti, Balamulaka, Vastuka, Patyamalaka, Murdvika, Patola Mudga. So these are some of the food which is supposed to be consumed regularly, because these food have the capacity to maintain the samatva of dosha and dhatu. So that is the reason the concept which are explained in the heading of Patya, Satmya, Itahara, those are supposed to be practiced regularly to maintain the samadosha, and we need to avoid the all the food which I explained in the previous slide, that vata prakopaka, pitta prakopaka aharas, and we need to stick on to the satvika aharas, that is rasya, snigdha, madhura rasa yukta ahara are supposed to be taken regularly, because these are satvika ahara. And tamasika ahara, all junk food, fast food, oil baked food, excessively oil baked food, and even artificially fermented food and refrigerated food, these will etayamam gatarasam puti parushitam, that is which is refrigerated food, which is leftover food. Those food are not supposed to be taken, because those will vitiate the tamas and rajas dosha of the mana. So in such a way, ahara variation should be done, and there are numerous research which says that nidra alone will helps to 60 to 70% of stress. So always when the person is exposing to the any kind of stress, always make the person to get the good sleep, and preferably sleeping at the night is mandatory, because Ayurveda says that ratri jagaranam ruksham snigdam praswapanam diva. Suppose if the person make the like ratri jagarana, that will vitiate the vata dosha. If person to compensate the ratri jagarana, if the person go for day sleep, again it is going to vitiate the kapha dosha. So rather than advising in such variation, make the person to take good sleep at the night. Ayurveda says that to get the good sleep, what are the modalities we need to accept is that sayam bhuktam lagu hites samahita suchi. That is, Ayurveda says that if you want to get good sleep, you need to have the dinner at early evening. That is sayam bhuktam, sayankala person should take the food, because nowadays people have the habit of eating the food late night. Having the food in late night, again it is going to affect your digestion and metabolism. If digestion and metabolism is affected, obviously you won't get the sleep properly. So you need to have the food in dvitiya bhojanam ardha chaturtha praharopari. Second meal should be between 7:30 to 8:15 p.m. So this is the classical reference for the dinner. So time for dinner is that Dvitiya Bhojanam Ardha Chaturtha Praharopri, that is 7:30 to 8:15 p.m. is the appropriate time to have the food. After having the while having the food, how the quality should be. They say that Sayam Bhuktam Lagu, it should be easy digestible. Sayam Bhuktam Lagu, and it should be easily digestible, and it should be hita, that is it should be wholesome. Nowadays people have the habit of eating all the fast food, pizza, burger at the night, again these will activate your mood. If your mood is activated, if your metabolism is activated, again you are not going to get the good sleep. So Ayurveda says that sayam bhuktam lagu hite, lagu hite. So again Ayurveda says that like a person should drink milk at the night. Especially purpose of drinking milk at the night is to get the good sleep. Milk has the tryptophan induces the good sleep. So Ayurveda says that bhojanante pibet takram, vasarante pibet paya. Vasarante is nothing but at night you need to always drink the milk, because of jivana, brahmana, snigdha, it will induce us the good sleep. And even Ayurveda says that like shirashravana padeshu visheshena shilet, abhyanga should be done, especially oil massage to the foot regularly at the bedtime will induce us the good sleep. And mana prasanna gandha shabda samvana nicha, what I stated earlier, listening to the cozy music at the night and inhaling the fragrant material at the night will induce us the good sleep. And another very important part is even we need to focus much on bed matters, because Ayurveda says that yuktopadanam swastiranam vistiranam vishamam samam, that is even bedding is also very much important to get sleep. If your pillow is not appropriate, if the cushion is not there, if your bed matters are not appropriate and the length of the bed is not appropriate, again you are not going to get the good sleep. So always even we need to focus on which kind of bed matters the person is using. So accordingly you need to change. Again Ayurveda says that prag dakshina shirsha padav karvanu gurun, that is while sleeping you need to face the head towards the east and south direction. So if you sleep by facing the head to east and south facing, again induces the good sleep. What I'm saying is that these are all proven by the research. So as I was saying that if you want to combat the stress, you need to have the good sleep. There is a long lasting relationship between the stress and sleep. Good sleep will reduces the stress. Again, sleep deprivation will leads to the stress. That is the reason always make focus to have the good sleep at the night. Then influence of bed firmness, as I stated, Ayurveda says that yuktopadanam swastiranam vishamam sama, that is the upadana, that is pillow, matters, whatever we are using, bed matters, it is also having the effect on the sleep quality. So we need to see which kind of bed matters the person is using. So these are some of the research which says that even there is the influence of bed firmness, and even all the design of the bed matters, everything matters to get the good sleep. And again late night eating, as I stated, sayam bhuktam, Ayurveda says that person should have the food in sayankala. Suppose if you have the habit of having the food in late night, again it is going to disturb your sleep by disturbing or by slowing down the digestion. Vyayama, as I stated, again Vyayama, regularly indulging in Vyayama, and preferably Vyayama should be Ardha Shakti, because excessive involving in physical activity come under the heading of Ayasa, that is excessive exertion. So that is the reason Vyayama should be done regularly, but it should be Ardha Shakti. If the person do Ardha Shakti Vyayama regularly, again it will induce us the good sleep. This is the one of the research where it says that. And Sayam Bhukta, Sayankala Bhojana, why is mentioned? Relationship between the food intake and sleep pattern. If early you take the food, it will induce us the good sleep. Late you take the food, it will leads to the anidra. Again, different matters. Again, same thing. What is the importance of all this pillow, everything? And Nasya, as I stated, Sayankala Nasya will induce us the good sleep. So again, if the person is the victim of insomnia, again to get the good sleep, person should go for Dinante Nasyam Shroto Vishodanam Sukha Swapna Prabodhanam. So regularly Pratimarshanasya done in the Dinante evening will induce us the good sleep, and it will help to tackle the conditions like insomnia. Abhyanga, again, as I stated, Shirashravana Padeshu Shilet. So Visheshena Shilet, every day massage, especially foot massage, will helps to induce us the good sleep, make the person to massage the foot at the bedtime to get the good sleep. Again, Mana Prasanna Gandha Shabdan Nicha. So and focusing on the good music, listening good music, and inhaling the good fragrant material will also induce us the good sleep. This is another research work. And as I stated that Prag Dakshina Shirsha Padava Karvana Gurun. So that is direction of the sleep is also very important to get the sleep. So this is the one of the research work where it has been stated that if you sleep just facing the head towards east or west, or again how exactly it is going to affect your body, it has been stated that facing your head to east or west will increases the latency period of that it will decreases the REM. So decrease of REM indicates that the person is having the sound sleep. If more the REM, rapid eye movement, if it is more, it indicates that person is not in the good sleep. So if you just sleep facing the head towards the east, will shortens the REM latency period. That is, it induces the sound sleep. So this is the importance of what we call like sleeping with particular direction. And sadvruta, we all know that sadvruta, there are many more things explained in the Ayurveda. Because of time constraint, I am not going to focus on these things. Just here we need to like respect each and every person. If you are doing any work, if you are doing any job, you need to respect your employer, so that he won't torture you. So ultimately, even Ayurveda says that we need to respect, that is guru, brahmana, acharya, we need to respect. Again, that respect will also help you to tackle this stress like condition. And even Ayurveda says that purvabhibashi sumuko purvabhibashi sumuko shushilo, that is, even you need to be more active, and you need to be extrovert, and you need to speak with every person. If you have the tendency of speaking with every person by your own, then that will also reduces the stress like condition. Again, all the siddhantas which are explained in the Ayurveda literature, you need to accept as it is. You are not supposed to use your skill. If there is any reference in the classics, you should accept as it is and start implementing in your day-to-day life. That will also helps to tackle the stress like conditions. And always be in the company of good people, intellectual people, because whenever you face any kind of stress, always try to share with your friends. If you have a good company, you can share. If you share your all the problems, 50% of your problem will be get solved by the suggestions received from the good company or intellectual person. Always you need to have the tendency of making the good friends to tackle the stress like condition. And coming to the yoga, we all know that yogena chittasya padena vacha malam sharirasya tu vaidikena. So to tackle the chitta, to tackle the mental factor, yoga shastra is appropriate. So ultimately, to tackle the stress like condition by yoga, always have the habit of practicing the surya namaskara or all kind of asanas. It may be standing series, sitting series, prone, supine, followed by the pranayamas like nadi shodhana, kapalabhati, bastrika, ujjayi, brahmari. These are the, and even like dhyana, that is especially meditation. It may be omkara meditation, or it may be the cyclic meditation, or it may be mind sound resonance technique meditations. So these are the various methods which will fall under the category of yoga, which will help to control the psychological part of the every individual. And again, as I stated, nowadays many people are carrying the stress like condition from the office. So in between the office, in between the office work, if you just spend 5 to 10 minutes for the office like yoga, office yogas, that will also help to tackle or reduce the stress like condition which is going to occur at the workplace. So by using the chair, if you are sitting on the chair, in chair itself, after continuous working for 2 or 3 hours, 10 minutes if you relax and if you do certain yoga using the chair, that will also help to tackle the stress at the offices. So in such a way, using the office props, even you can perform the yoga and tackle the stress like condition at the workplace. So coming to the conclusion, so in Bhagavad Gita, it has been stated that Udderat Atmanam Atmaniyon Atmanam Avasadayati Atma eva hi Atmanam Bandhu Atma Ripuratmanah. That is, we are the self, we are the culprit for our own sin, or we are the culprit for our own like ailments. So if you are suffering from the stress, it is not because of the outsider, because we are failing to tackle the stress like condition. So we are the major culprit for all of the changes which are happening in our mind and body. So first we need to train ourselves. We need to control ourselves. Once if your mind, indriya, mana are controlled by yourself, then all things can be controlled. So here again, so stress can be controlled when you control your indriya and mana. To control indriya and mana, you need to accept all the principles which are explained in the Ayurveda Siddhanta. Because nowadays many messages will be scrolling in the WhatsApp and Facebook. By seeing that, people will start accepting those things. But you are not supposed to accept anything which is circulated in the social media, because they may not be having any scientific evidence, they may not be having any classical references. Ayurveda says that sukartam sarvabhutanam mata sarva pravartaya sukam dharmatta vinacha bhavati tato dharmo paro bhavet. That is, whatever the activity you are going to do, if it is according to the dharma, that is, if they all the activities are according to the fundamentals, according to the siddhantas, that particular activity is going to give the fruitful result. So always you need to accept those principles which are written in the Ayurveda literature. And to tackle the stress like condition, there should be a holistic approach. Just doing meditation is not sufficient to tackle the stress. Even you need to focus on the ahara, vihara, achara, vichara. So when you focus all together, then only you can tackle this stress like condition. Coming to the conclusion, there is a like yuktahara viharasya yukta chostasya karmasu yukta swapno bodhasya yogo bahudu dukkha. That is, to tackle the any kind of dukkha, there should be yukti kruta ahara sevana, yukti kruta vihara sehana, yukti kruta nidra, yuktahara viharasya yukta chestasya karmasu. Everything should be done with vigilance. If there is a vigilance in everything, then you will be free from all sort of condition. Even you can tackle this stress like condition. This is my submission, and thank you for your opportunity for presenting me here. And thank you, and all for your patience listening. Thank you.
बहुत बहुत धन्यवाद डॉक्टर काशीनाथ जी, आपने इस विषय के साथ बहुत ही न्याय किया है और इस विषय से संबंधित जितने आयाम और पक्ष हो सकते हैं उन सबको आपने सिद्धांत के साथ, व्यवहार के साथ और आधुनिक विज्ञान का पुट देते हुए बहुत ही अच्छे ढंग से हमारे सामने रखा है। वंस अगेन थैंक्स। जेवीएनस के हम जयती विद्यापीठ परिवार की ओर से आपका हार्दिक धन्यवाद करते हैं। आगे सत्र संचालन के डॉक्टर शिखा
जी सर, thank you sir for sharing such a knowledgeable presentation with us, and I think you almost covered all the Ayurvedic principles mentioned in our texts, in our Vedas, to control and to overcome the situation of stress or any mental ailment. It was really very pleasant surprise to us. And once again, thank you so much, sir, for delivering such a wonderful lecture. Thank you.
Thank you, ma'am. Thank you.
Now, I would like to request our technical team, please play the video blessings from Dr. Sanjay Pokhrel, as he is unable to connect us due to some problem, but he's share his video blessings to us for this 2 days international conference. Technical team, please play the video.
Namaste to everyone from the land of Himalayas, Nepal. I am very much glad to know that Jyoti Vidyapith Women's University Jaipur is organizing the international conference on the topic stress management and lifestyle disorders management through the principles of Ayurveda and yoga. As we all know that the prevalence of lifestyle related disorders like hypertension, diabetes, obesity, or the prevalence of stress related disorders are the major challenges in the society nowadays. Our ancient science, Ayurveda and yoga has a lot to offer in this context. So, I would like to congratulate the entire team of the university, especially Dr. Sikha Sharma, Dean and Director of the Faculty of Ayurvedic Sciences in Jyoti Vidyapith Women's University, and her entire team for choosing such a relevant topic for the international conference. I am very sure that this conference will be a very good platform for the researchers, for the academicians, as well as for the students all over the country to share and exchange their knowledge and ideas regarding the principles and the trends being practiced in Ayurveda for the management of such disorders. Lastly, I wish all success for this international conference. It will be definitely a very fruitful event. Thank you. Thank you, one and all.
Thank you, technical team, for playing this video. And on behalf of the organizing committee, I would like to thank Dr. Sanjay Pokhrel for sharing his video blessings to us. And our registrar ma'am assured us that in near future we will work in collaboration with you, sir. Now I would like to introduce and call upon our next guest speaker, Dr. Abhishek Sharma ji, President Sevarat Yog Prakritik Chikitsa. Sir, sir, yes, sir. Over to you, sir. Dr. Abhishek Sharma ji. Welcome, sir. Hello. Dr. Abhishek Sharma ji, kindly unmute, sir. I think there is some issue in the network. Okay, now I would like to request Dr. Anushka, uh, please start the presentations of our internees. Over to you, Dr. Anushka.
Good morning, ma'am. Good morning, all of you. Am I audible to you all?
Yes, you are audible,
Yes.
ma'am.
Yes, ma'am. Ma'am, can we start the presentation?
Yes, yes, sure.
Yes,
Start
please.
the presentations.
Yes, ma'am. So, first of all, our first presentation is about Swarn Bhasma on various diseases by Himlata Yadav, BMS interns.
Namaste and a very warm good morning to all honorable chief guests and teachers and all the students. I Himrata today present a topic Swarn Bhasma, which plays very important role in our Ayurvedic pharmacology. First, we know what is Swarn Bhasm. Swarn Bhasm, which is also known as gold bhasm, it consists of nano and colloidal gold particles, being a powerful resonative, antitoxic, antioxidant, cardioprotective, and nervine tonic. It is remedy for numerous physical problems and has a positive effect on overall health, which promotes heart health, increases lifespan, intelligence, memory, skin glow, and prevents several diseases. It is also extremely useful in case of tuberculosis, chronic fever, asthma, thesis, cough, burning sensation, acidity, microbial infection, loss of vitality, toxicity, infertility, conjunctivitis, rheumatoid arthritis, etc. It is also increases overall strength and endurance and improves mental health. Now, how to formulate Swarn Bhasm? So, ingredients are Suddha Swarn, which is purified gold, Suddha Gandhak, which is purified sulfur, Suddha Parat, which is purified mercury, Arand Patra, castor leaf. So, health benefits of Swarn Bhasma promotes cardiac functioning. Cardiac tonic and cardiac protective properties in Swarn Bhasma is extremely effective in treating various heart anomalies due to its strong antioxidative nature. It not only strengthens the heart muscles and detoxify the blood, but also prevents the deposition of plaque in the blood vessels and cleans the coronary arteries. It also avoids the formation of arteriosclerosis and hence reduces the risk of heart attacks, blocks, blood clots, ischemic cardiomyopathy. Second is relaxes the mind and improves memory. Adaptogenic, anti-anxiety, and sedative properties in the swan blossom not only improves the mood but also relieves the symptoms of stress like anxiousness, lack of attention, ignorance, and irritability. Holds high significance in providing mental stability by regulating the stress hormone, that is serotonin, which in turn reduces restlessness, uneasiness, cold hands and feet, etc. Third one is bolsters immunity. Immunity that acts as the first line of defense case of infections. Swanbasm offers an absolute remedy for enhancing the immune system, fighting microbes, and shielding the body against various infections. Also portrays the presence of strong antiviral and antibacterial and antifungal properties, which is extremely effective in preventing infections like fever, common cold, TB, and other skin infections. Fourth one is combats respiratory issues. Anti-inflammatory, antibiotic, and anti-asthmatic properties in swan bhasm make it to sort of respiratory distress. It treats common cold, sore throat, cough, and flu symptoms. When taken alongside Shring Bhasm, Praval Pisti, and Giloy Sattva, Swan Bhasm actively thins and loosens sputum particles within the lungs, chest, and nasal cavity and eases breathing. Last one is treats conjunctivitis. The antimicrobial properties in swan bhasm helps to treat conjunctivitis when ingested along with mukta pisti, praval pisti, and giloy sattva. Now, effect on doshas. The colloidal gold particles within swan bhasm is blessed with mainly madhur, Kasairas, and which is prominently showcases Laghu and Snigdha Gun. It is also as Sheet, Virya, and Madhur Vipak. This golden formulation pacifies all three doshas, mainly Vat, Pitta, Kapha doshas, and has a positive effect on various dhatus, which are Ras, Rak, Mas, and Shukra. Swan Bhasm increases physical power and enlightens not only our mind but also our physical body. Now, dose of Swan Bhasm. As mentioned in Ayurvedic text, the dose of Swan Bhasm is 1 by 8th to 1 by 4th rati, where 1 rati is equals to 125 mg, that is one take this formulation daily mixed with honey or ghee twice a day, preferably 30 minutes before meal or 2 hours after a meal. Now, side effect of Swan Bhasm. Oral gold therapy shows self-limiting digestion-related symptoms such as diarrhea. Several hematological responses such as eosinophilia, thrombocytopenia, and aplastic anemia were reported when chrysotherapy was used. The use of swanbasm in case of high-grade fever during tuberculosis is contraindicated since the formulation kills the bacteria quickly, which ultimately results in excessive toxin accumulation within the body cavities produced by dead bacteria. Thank you.
The topic of second presentation is effects of lifestyle changes on symptoms of PCOS and its Ayurvedic interpretation by BMS intern Priyanshi Singh. Over to
Dr.
you,
Anushka.
Ji,
Dr.
ma'am.
Anushka, ma'am, please wait a second. If I think if our pro president sir is here, Kamleshi sir, I think he has left now. I was trying to invite him for giving some suggestion to our internees for their presentation, but I think he's not there. So over to you, Anushka ma'am. You may continue now.
Thank you, ma'am. The next presentation is about effects of lifestyle changes on symptoms of PCOS and its Ayurvedic interpretation by BMS intern Priyanshi Singh. Over to you, Priyanshi Singh.
Namaste and a very good morning to Honorable Advisor and CEO Sir, all the respected Ayurveda delegates, respected Registrar Ma'am, respected Dean and Directors, respected teachers, and my dear JVNs. In today's modern era, where technologies and facilities are increasing day by day, as a result, quality of lifestyle and human behaviors are affecting enormously, resulting in increased number of diseases in the world, especially lifestyle disorders. Among the many lifestyle disorder, major one is PCOS. So I, JVN Priyanshi Singh, presenting today's topic on the effect of lifestyle changes on symptoms of polycystic ovarian syndrome and its Ayurvedic interpretation. So, first of all, the introduction of PCOS is a complex condition in which women ovaries develop cysts or follicles, making them bigger than average size. PCOS or PCOD is a common hormonal disorder among women of reproductive age. The condition is characterized by excess androgen levels, irregular menstrual periods, and small cysts in the ovaries, which results in infertility, obesity, and other health issues. PCOS is not specially identified in the Ayurvedic text, but the diseases of uterus are mentioned as Garbh Rog. PCOS is oftentimes classified as GUL. PCOS is also sometimes labeled under the classification of Granthi, which refers to a tumor, cyst, lump, or ulcer. Etiology is unknown, but mainly lifestyle changes, or can say poor lifestyle, is the cause, like not following proper diet regime, not doing any physical activity, no social contact, stress, smoking, or alcohol consumption. That's why first line of treatment of PCOS involves lifestyle modifications. Women with PCOS are more prone to suffer from depression, low self-esteem, disordered eating, anger issues, poor quality of life, mainly due to increased hormones like estrogen and testosterone, luteinizing hormone, and decreased secretion of follicle stimulating hormone. Risk factors of PCOS. Lifestyle factors alone don't cause PCOS, but they can work with genetic and environmental factors to increase risk. Risk factors are as insulin resistance, low-grade inflammation, endometrial cancer, obesity, cardiovascular diseases, diabetes mellitus, metabolic abnormalities, and sleep disorders. Management of PCOS. PCOS affects all the three doshas. What treatment for PCOS that are nourishing diet, meditation, breathing exercises, and other grounding practices help to balance the vata. With treatment for PCOS are cool, bitter, and sweet foods. Pranayam exercises are effective to balance pitta. Kapha treatment involves light, bitter, and astringent foods, heating pranayam exercises, earlier walking time earlier walking and warming activities such as sunbathing or use of saunas are also indicated. In the treatment of obesity, anima or bastis are prepared with trifla that can be recommended. Management, depression. in PCOS is vitally important. The quality of life in women with PCOS has been reported lower than of normal women and even lower than of people with some diseases such as diabetes, asthma, and epilepsy, and can be treated through the use of exercise and use of herbs such as Shatavari, Chandraprabha, Shatpushpa, Manjishta, and Guglu. So, investigation recommended in PCOS are pelvic examination, blood tests, ultrasound, regular checks of blood pressure, glucose tolerance test, cholesterol and triglycerides levels test, screening for depression and anxiety, screening for obstructive sleep apnea. So, the conclusion of my presentation is proper diagnosis and management of PCOS is essential, as PCOS has many potential metabolic and serious risks if not managed properly. Treatment should be individualized. It should also focus on all metabolic consequences and decreasing future complications. Ayurveda management is very fruitful in treatment of PCOS and associated conditions. Ayurveda therapies can easily reduce the weight and also the symptoms of PCOS. It helps to lower the insulin resistance more effectively, thereby favoring ovulation, which is one of the prime factors for the maintenance of fertility. Thank you and have a nice day.
Dr. Anushka,
Moving forward, yes, ma'am. Moving forward, the third presentation is about a critical review of hypothyroidism by Shreya Ambastra, BMS interns. Namaste and very good afternoon to Honorable Advisor and CEO Sir, Honorable all the Ayurveda delegates, respected Registrar Ma'am, respected Dean and Directors, respected teachers and my dear JVNs. I, JVN Shreyam Basta, presenting in front of you on the topic hypothyroidism, a critical review. Hypothyroidism is a disorder that occurs when the thyroid gland does not make enough thyroid hormone to meet the body's need. Hypothyroidism is a common condition in which thyroid gland provide insufficient amounts of thyroid hormone for the needs of peripheral tissue. The most common cause in adult is chronic cystic thyroiditis. Thyroid hormone. Thyroid hormones are produced by thyroid gland. This gland is located in the lower part of the neck below the Adam's apple. The gland wraps around the windpipe and has a shape that is similar to a butterfly, formed by two wings and attached by a middle part isthmus. The two most important thyroid hormone are thyroxine T4 and triiodothyroid T3. Thyroid hormone regulation. The thyroid itself is regulated by another gland located in the brain called the pituitary. In turn, the pituitary is regulated in the part by thyroid hormone that is circulating in the blood and in part by another gland called the hypothalamus, also part of a brain. The hypothalamus releases a hormone called thyrotropin releasing hormone TRH, which sends a signal to the pituitary to release thyroid stimulating hormone TSH. In turn, TSH sends a signal to the thyroid to release thyroid hormone. This pictures in front of you shows the hormone release pathway in which hypothalamus is stimulated and which send a feedback to pituitary to secrete TSH in follow pituitary secrete T4 and T3 hormone. This picture shows the pathogenesis of hypothyroidism. Causes: it is a very common condition. It is estimated that 3% to 5% of the population has some form of hypothyroidism. The condition is more common in women than in men, and its incidence increases with ages. Some common conditions are as follows: lymphocystic thyroiditis, which may occur after hypothyroidism; thyroid destruction from radioactive iodine or surgery; pituitary or hypothalamic disease; severe iodine deficiency. Some common symptoms are as follows: weight gain, a puffy face, cold intolerance, joint and muscle pain, constipation, dryness of skin, dryness and thinning of hairs, decreased in sweating, heavy or irregular menstrual periods, depression, heart rate slows down, excessive sleepiness, dry, coarse hair. Diagnosis: a diagnosis of hypothyroidism can be suspected in patient with fatigue, cold intolerance, constipation, and dry, flaky skin. A blood test is needed to confirm the diagnosis. When hypothyroidism is present, the blood level of thyroid hormone can be measured directly and are usually decreased. However, in early hypothyroidism, the level of thyroid hormones T3 and T4 may be normal. Therefore, the main tool for the detection of hypothyroidism is a measurement of the TSH, the thyroid stimulating hormone. Treatment: amiodarone, a heart medication. The average dose of T4 replacement in adults is approximately 1.6 micrograms per kilogram per day. This translates into approximately 100 to 150 micrograms per day. In young, healthy patients, the full amount of T4 replacement hormone may be started initially. Thank you. The next topic of paper presentation is critical approach of management of COPD in Ayurveda by Ankita Chaube, BMS intern. Namaste, Namaste and very good afternoon to Honorable Advisor and CEO Sir, Honorable Guest, respected Registrar Ma'am, respected Dean and Directors and Teachers and my dear JVNs. I am representing my article on topic Critical Approach of Ayurveda in Management of COPD. COPD is a chronic inflammatory lung disorder that is cause of suction of airflow from lungs. COPD is the second most common lung disorder after pulmonary tuberculosis. It is an equal
And
problem in
namaste
urban and rural
to
areas.
everyone from the land of
In
Himalayas,
Ayurveda,
Nepal.
COPD is respiratory
I'm
disease
very
which
much glad.
occurs due to the involvement of pranvaya shrotas, kas, and tamak swas may be the result of pranvaya shrotas dushti in our COPD. Ayurvedic management can ultimately and eliminate, destroy root cause of disease. COPD is a main cause of morbidity and mortality in India. Risk factors for COPD: exposure to tobacco smoke accounts for an estimated 80 to 90% of COPD cases. Smoking, passive smoking, occupational exposure, ambient air pollution, genetic abnormalities including a deficiency of alpha 1 antitrypsin enzyme, causes of COPD, lifestyle, excessive smoking, wind, fume, overexertion, physical exertion, tobacco, occupational hazards like chemicals, dust, charcoal, and gas are the main cause. Diet, excessive intake of kidney beans, unboiled milk, aquatic and marshy meat. Diet habits, Vishmasan. Investigation, alpha antitrypsin level, CT scan, spirometry, chest X-ray, carbon monoxide transfer factor. Management. First, Nidan Parivarjan. Patient desire to keep away from reason elements like smoking have to be stopped. Avoid day sleep, avoid touch with heat, cold irritants. Second, Shodhan Chikitsa. Extra Kapha dosh will elevate. It include Vaman, therapeutic emesis, Virechan, therapeutic purgation, Basti, therapeutic anemia. In Swas Rog, it should be applied on Balwan Rogis. Depends on Ritu and Kal. According to Charak, Tamketu Virechan means special indication of Virechan come in Tamak Swas. By Virechan, Gati of Bath become downwards. It will remove obstruction which caused by Pratilom Gati of Bath. Third, Shaman Chikitsa. There are some drugs which can alleviate vitiated cough and may dry out excessive mucus secretion. Conclusion, COPD being a chronic progressive disorder with irreversible chances which needs proper management and early diagnosis. Diet pattern modification, lifestyle, extra care of diet can play a major role in prevention of COPD. In Ayurvedic science, Ahar Vihar is beneficial and nutritional to body and gives happiness to mind. In Charak Samhita, any drug which is Vashamak, Vatanulomak, Ushn can be used in Swas Rog as Aushad and Ahar Vihar. Thank you.
Dr. Anushka. Anushka, ma'am.
Yes, ma'am.
I would like to add a suggestion for all the internees and our presenters. If you mention any investigation in your presentation, then it should also be pictorial. Like you may present any x-ray of chest x-ray as the previous presenter mentioned in her investigation section. So आप अपनी इन्वेस्टिगेशन स्टडीज जो होती हैं उसमें किसी एक पिक्टोरियल प्रेजेंटेशन को भी रखिए, कोई ग्राफ भी रखिए. I know you are at very early stage, but it will make your presentation very effective. So keep this in mind for future presentations. It's only a suggestion.
Right, ma'am. Thank you, ma'am. The next presentation is about stroke, a lifestyle disorder to each by Ayurvedic management by Mrinalini Sharma, BMS intern.
A very good morning to the Ayurvedic faculty, the management, and my dear fellow students. I, JB Mrinalini, is here to present the topic on stroke, the effective approach of Ayurvedic management. So, so it's one of the major neurological disorders, manifested inability to move the group of muscles of either left or the right side of the body. The term Pakshaghat, the stroke is also known as Pakshaghat in Ayurvedic terms. Pakshaghat and Ekang, these are the synonyms of the same disease. Charak included it in the classification of Nanatmaj Vyadhi due to predominance of Vata dosh. The disease affects मध्यम रोग मार्ग जिसमें कि मर्म अस्थि संधि आते हैं and disrupts the function of सिरा जिन्हें blood vessels कहते हैं, स्नायु ligaments और कंडरा जिन्हें tendons कहते हैं और etc. ऐसे affect करता है. So according to modern terminology, it's also called as hemiplegia. It's usually the sequel cerebrovascular disorders or stroke, and most cerebrovascular diseases are manifested by abrupt onset of a focal neurological deficit. So, lifestyle stress disorders are linked to the way people spend their lives. Some widespread lifestyle diseases and syndromes are hypertension, stroke, obesity, heart diseases, hormonal imbalances, and more. There are results of
Hold on, please listen. You don't read, these line by line. You come in a discussion mode. Tell your topic, why it is important. If introduction is there, give few examples. May take few minutes in presentation as per your capacity, because this is a learning stage. We don't want to question you. Okay, why didn't you telling this? Why didn't you? In your own words, you see words from here. It's not like this. You're coming in 1 minute and you're gone. That is not the motive. This is the right time. I'm telling you to learn the things how to present. Even 3 4 bullets are in front of you and you speak for 20 minutes, 25 minutes. That's why we organize these conferences, to develop that type of skill. And you should be more confident because your director madam is here herself. She will help you out if there is any issue. Okay, so start your presentation and think that you have to make your topic understand to those who are connected with you. All the best.
Thank you, sir. So it's basically it's we can say when the damage is caused to the brain by when there is interruption in blood supply or blood vessels, it causes paralysis of the body. So it is one of the major diseases, as it is also connected to the Vata dosh, because our acharyas have told us that Vata dosh are the main doshas of our body. And in most of the cases, a patient is left with a long-term disability such as paralysis, and Ayurvedic therapies help that it helps in regaining the strength and health faster. And Panchkarm is broadly used in such diseases. And according to Ashtang Sangra, there are many treatments given, and they have described the room quite well. And the technique is mentioned in Sarangar Samhita as well by and Sushruta sir. So before that, then the patient is evaluated by an Ayurvedic doctor to establish their प्राइमरी कंस्टिट्यूशन. मतलब प्रकृति के हिसाब से ही हम लोग किसी भी पेशेंट को ट्रीट करते हैं. और इसमें सबसे पहले हम लोग अभ्यंग करते हैं. अभ्यंग में हम लोग मतलब प्रकृति के हिसाब से ही, जैसे अगर किसी को वातिक है तो निर्गुंडी तेल का हम लोग यूज़ करेंगे और उसका ट्रीटमेंट जैसे 14 दिनों तक चलता है। और फिर अभ्यंग के बाद हम लोग स्वेदन देते हैं। और अभ्यंग में हम लोग मतलब अगर ऐसा भी होता है कि अगर 14 दिनों के बाद भी पेशेंट को रिलीफ नहीं मिलता है तो हम लोग और 14 दिन तक करते हैं, मतलब फिर 28 दिन तक का वो ट्रीटमेंट चलता है पेशेंट का। फिर स्वेदन भी हम लोग जैसे षष्टिका शरीर पिंड स्वेद से दे सकते हैं। और बहुत सारे मेडिसिनल ऑयल्स आते हैं। फिर उसके बाद विरेचन होता है जिसको हम लोग पर्गेशन कहते हैं। इट इम्प्रूव्स द ऑपरेशन ऑफ द नर्व इन द अफेक्टेड एरिया। और बस्ती देते हैं जिसको कि मेडिकेटेड अनीमा कहते हैं। इसको भी 8 से 32 दिन तक हम लोग दे सकते हैं। फिर नस्यकर्म होता है और इससे ही हम लोग के जो मसल्स होते हैं उसमें बल प्रदान किया जाता है और नर्व्स और सर्कुलेशन भी इम्प्रूव किया जाता है। और ऑयल एनिमा में जैसे अनुवासन डिकॉक्शन एनिमा दे सकते हैं हम लोग और इसको सुश्रुत संहिता में मेंशन किया गया है। फिर इससे क्या होता है कि जो द एग्रावेटेड वात दोष प्रोड्यूसेस स्पेसिफिक डिजीजेस because of the specific nature of the causative factors and the seeds of the manifestation. When all the nerves are afflicted with vitiated vata dosh, it created scissors. और इस जो हम लोग ट्रीटमेंट देते हैं उससे वातिक जो भी प्रकृति में मतलब वो शांत हो जाते हैं। और वो खैर ट्रीटमेंट तो बहुत लंबा चलता है इसका। थैंक यू सर।
Dr. Mrinalini, I want to ask a question from her, Anushka ma'am.
Yes, abhi kya hoga? The thing is that once they
Yes,
present, they have to stay here. So call her back because, yeah, naturally, without
Yes,
any
okay, sir.
moderation or asking a question, there is no meaning that it is a conference. So
Okay, sir. Okay.
call her back and ask the questions. And actually, I missed half of the presentation, but I will try to be stick here. Yes.
Okay, okay, ma'am, continue.
आप शिखा मैडम को क्वेश्चन पूछने वाले थे इनसे।
एक्चुअली सर मृणालिनी जो है आपने मेंशन किया था एक बहुत ही अच्छा आयुर्वेदिक पॉइंट आपने मेंशन किया था मृणालिनी दैट वी शुड नॉट अभ्यंग आफ्टर 14 डेज। मैं उसी को एलैबोरेट करना चाह रही थी। बच्चे आप यहाँ पर ये बता सकते थे बिकॉज कॉमन पीपल मस्ट नो कि एक बहुत ही सिंपल सा कंसेप्ट है। इफ बॉडी में आप लॉन्ग ड्यूरेशन के लिए कोई मेडिसिन यूज करते हैं देन इट बिकम्स एडेप्टेबल टू इट। एक सर्टेन थ्रेशोल्ड लेवल जो है वो रीच हो जाता है। सो आफ्टर गिविंग अ गैप अगेन वी कैन डू अभ्यंग और स्नेहन। तो आप इसको एलैबोरेट करते तो बहुत ही अच्छा पॉइंट है ये। थैंक यू।
ओके थैंक यू।
Next presenter. Next.
Next presenter, please.
Yes, ma'am. The next topic of presentation is about the crown chakra. जैसे कि हम योग में मानते हैं कि हमारे सप्त चक्र हमारी बॉडी में होते हैं, कहीं पे अष्ट चक्र भी माने जाते हैं। तो the next presentation is about the crown chakra, its science and its application by BNYS third year students Bhuvneshwari and Diksha.
Who is this Mr. Chanchal Suryavanshi? ये कौन है शिखा मैडम? आप कोई गेस्ट हैं या यहीं के कोई?
Sir, he is speaker for the post lunch session.
Okay, post lunch session.
जी सर।
Next time when you organize, make sure that one session chair must be for all the sessions. Who must be with you right from opening till the end of the, like, before noon session, one in afternoon session, who will listen all these presentations, moderation. All right, and the speakers will come and go.
Yes,
So
sir.
आपको क्या करना था, मैसूद, आपको पता होगा कि एक एक हर सेशन में एक एक सेशन चेयर होते हैं जो कि बच्चों के पेपर सुनते हैं, उनको मॉडरेट करते हैं। तो आपके पास 4 होने चाहिए थे, है ना, 4
Yes, sir.
सेशन स्पीकर्स, और बाकी की नोट स्पीकर्स दे आर कमिंग एंड गोइंग, स्पेशल स्पीकर्स हैं, गेस्ट स्पीकर्स हैं, वो तो ऑलराइट। एनीवे, सो
Yes, sir.
आफ्टरनून में स्पीकर्स आर कमिंग।
Yes, sir. Guest speakers are Dr. Leena, Dr. Chanchal Suryavanshi, and
Okay.
our Vishwavasu God, sir.
Okay, all right, good.
Namaste, all higher dignitaries, respected faculty members, and all my dear Javians. I, Javian Bhuvneshwari Singh,
And I Javian Diksha Katiyar.
welcome you all to the International Conference on Stress Relief and Lifestyle Disorder Management in context to Vedas. And our topic is the crown chakra and its applications. In this presentation, presentation comprises of the introduction, types of chakras, introduction to crown chakra, how to activate and balance the crown chakra through meditation, yogasanas, nutrition and diet, and at last the conclusion. The word chakra in English means wheel. These are continuously spinning and controlling different aspects of our inner self and the components of the subtle body. There are 7 main chakras starting from the root of spine and continuing towards the crown of your head. The material body has relatedness to each of these 7 chakras, associated by channels called nadis. They are mainly divided into 3 fragments: Ida, the left channel; Pingla, the right channel; and Sushumna, the central channel. This is the position of all the chakras in the human body. First, the Muladhara chakra.
Go back to last slide, please, and name these chakras. In a minute, you said these are the chakras. You're presenting, all right. So tell that in the top, this chakra, in the after that is the second chakra. What are the importance of these chakras? As much as you can tell comfortably. But on every, if there is a slide, on every slide, one has to give 1 minute, 2 minutes, 4 minutes, depends on the priority of that slide. But you cannot say that these are the chakras and go to the next one. Kindly explain.
Okay, sir. So this is the position of...
Yes, please continue.
So this is the position of all the chakras, starting from the root chakra, which is Muladhara chakra. It is located to the organs such as large intestine, spine, feet, and legs. Now coming upwards to the Swadhisthana chakra, which is located below the umbilicus, and it represents the orange color of the chakra. Next, coming upwards is the Manipura chakra, which is related to stomach, large intestine, and represents yellow color. Now coming upwards is the Anahata chakra, which is related to organs such as lungs and heart, and associated with green color. Then Vishuddhi chakra is there in the throat, and it is related to the organs that are present in the throat. And Ajna chakra is present in the glabella, which is the region present between the eyes on the forehead. Then the Sahasrara chakra, which is present at the top of your head, also known as the crown. Now moving into these chakras, Muladhara chakra depicts the element which is earth, and located in the base of spine. The organs which are related to these chakra is large intestine, spine, legs, and feet. The sign of blockages are individuality, egoism, and dominance. The Swadhisthana chakra denotes the element water. It's located below the umbilicus, Organs related to this chakra are bladder, bowel, and large intestine. Signs of blockages is rigid intellect. The Manipura chakra denotes the element fire, located upper abdomen. Organs related are the stomach, the small intestine, and the upper back. Sign of blockages is self-doubt, aggression, and fear of failure. The Anahata chakra, which represents the element air, located in the center of chest or the heart. Organs related are heart and lungs. Signs of blockages are unforgiving nature and the person who can't let go of the past. The Vishuddhi chakra denotes the element ether and is located in the throat. The organs related are mouth and jaw. The signs of blockages are self criticism, the person who is non creative and fears rejection. The Ajna chakra denotes the element light, is located on the forehead between the eyes, and the organs that are related to this chakra is brain, skull, and eyes. Signs of blockages are despair, hopelessness, and self doubt. The person with this will be in self doubt always and will not keep his way of thinking to himself. And lastly, the Sahasrara chakra, which is located at the top of the head, and the element it denotes is cosmic energy and is located in the top of head. Locate organs related to this chakra as is pineal gland, and the signs of blockages are the person will be judgmental, will be poor in decision making, and will fear the being let down. Now coming to the crown chakra. The crown chakra is the seventh chakra that activates the divine energy, and the Sahasrara chakra is present in the top of your head. This word Sahasrara in Sanskrit means thousand and eternal petals of lotus. The awakening of crown chakra signifies broad flow of energy and spiritual enlightenment. It is either represented by white or purple light. It is thought to affect brain functions such as memory, intelligence, and thinking, load flow of energy, and spiritual enlightenment. The characteristics which Sahasrara chakra holds is it brings more positive outlook on life. It helps in it helps us to be no longer controlled by ego, and it brings spiritual understanding and peace with clear perspectives. It brings a strong emotion and relaxation and also the joy of transformation. When the crown chakra is imbalanced or blocked, one may experience delusionment, boredom, and melancholy. The signs of blockages are when one is too detached or too attached to the materialistic pursuits of existence, and he will always be stuck in his way of thinking and will feel reluctant to be open to ideas of others. The symptoms such as dissociation and disconnection also occur when the crown chakra is unbalanced. Now, the signs of hyperactivity of crown chakra includes cynicism, apathy, spiritual addiction, self-destructive tendencies, overwhelmed with knowledge, hallucinations, and complete dissociation with the real world. Now, I hand over this presentation to my co-presenter, Diksha.
So now, for the yogic and naturopathy management to activate and unblock crown chakra for according to Vedas meditation, these steps are: sit any comfortable positions like Sukhasan, Vajrasan, Padmasan, your back straight and your feet flat on the floor. Bring your head into the mudra positions, Gyan Mudra, Chin Mudra, by the placing your hand on the knees and turning your palm toward the sky. Close your eyes. Breathe in through your nose and out through your mouth. Continue to breathe slowly and evenly. Imagine the lotus petal unfolding in white. Visualize the white color surrounding top of the head and slowly spreading throughout your body. After 5 to 10 minutes, open your eyes and sit quietly for a while. Chanting the Om Seed mantra also help in deep meditation and crown chakra healing. Next, yoga asanas, Sirsasana. Sirsasana is considered to be an ideal positions to stimulating the energy.
एक मिनट एक
Sirsasana.
मिनट you tell me one thing, either you speak in English, that's fine. If you speak in Hindi, you explain Sirsasana without reading from here. Just tell शीर्षासन ये होता है, या यहाँ से हेल्प लेके अपने वर्ड्स में बता दीजिए। बता सकते हैं?
शीर्षासना शीर्षासना इसको बोलते हैं, इट इज द,
चलिए आप यहीं से पढ़ दीजिए, कोई बात नहीं, प्रैक्टिस कर लेना।
Sir, can I explain it in Hindi?
Yes, absolutely. Why not? This
Okay,
question
sir.
for both of you.
Okay, sir.
बताएं।
ये जो शीर्षासना है वो हमारे जो जैसे पोजीशन दिख रही है, हमारा हेड डाउन रहता है उसमें, तो ये हमारे क्राउन चक्र को स्टिम्युलेट करता है और जो एनर्जी का फ्लो है उसको इंक्रीज करता है। तो और जो शीर्षासना होता है वो सिर्फ हेड के हाँ पावर पे नहीं ले सकते, वो हमारी कोर मसल्स को भी इंक्लूड करता है एंड हमारी स्ट्रेंथ को, स्टेबिलिटी को एंड हमारे जो
अच्छा, मेरा एक क्वेश्चन है, इसमें मैं बीच में पूछ लेता हूँ, नेक पे कितना प्रेशर आता है? इसको देखने से तो ये लगता है ना, अमूमन हम सभी देखते हैं, मैं भी देखता हूँ, इतने सालों से शीर्षासन कर रहे हैं पीपल, तो मुझे ऐसा लगता है, आई डिडंट आस्क, मुझे ऐसा लगता है कि नेक पे कितना प्रेशर आता है, हेड पे कितना प्रेशर आता होगा, हाउ मच टाइम इट टेक्स टू लर्न दिस शीर्षासन? ए बिगिनर कितने टाइम में सीख सकता है?
15 days. सर जो बिगनर्स होता है वो 15 डेज में शीर्षासना सीख सकते हैं। अगर उसके लिए हमारे नेक पे प्रेशर नहीं आता है, हमारे हाथों पे और हेड पे प्रेशर आता है। उसके लिए हमको हैंड की स्ट्रेंथ बढ़ानी पड़ती है। पहले हैंड की स्ट्रेंथ के जो आसन्स होते हैं उनको
उसको प्रैक्टिस करना पड़ेगा।
हाँ, वो प्रैक्टिस
बताइए, ओपनली बताइए, बिकॉज ये कुछ नहीं है, इट इज नथिंग लाइक दैट कि आप हिंदी में नहीं बता सकते, आप बता सकते हैं। आपने बहुत अच्छी बात बताई कि पहले हैंड का एक्सरसाइज करना पड़ेगा, हैंड्स को स्ट्रोंग करना पड़ेगा, प्रेशर नेक पे नहीं आता है, हेड पे आता है, और 15 सेकंड को सीख सकते हैं।
अगर हमारी पोजीशन सही रहती है, पूरी बॉडी और स्पाइन इरेक्ट होती है, तो हमारे नेक पे प्रेशर नहीं आता है, पूरा प्रेशर हमारे हेड पे और हैंड पे आता है।
गुड, ठीक है, चलिए नेक्स्ट कंटिन्यू करें।
नेक्स्ट आसन इज शशांक आसन। शशांक आसन ये एक रिलैक्स आसन भी होता है, जो हम बहुत सारे योगासन कर लेते हैं, उसके बाद रिलैक्स पोजीशन के लिए भी शशांक आसन होता है। ये डीप, इसका जो शशांक आसन डीप कनेक्शन रखता है सहस्त्र चक्र से, क्योंकि हमारा जो हेड होता है वो हेड नीचे होता है, क्योंकि जो अगर सहस्त्र चक्र एक्टिवेट तब होता है जब हमारा पूरा बॉडी ब्लड फ्लो हमारे हेड की तरफ होता है। तो जब हमारे हेड की तरफ सारा ब्लड फ्लो होगा तो हमारे जो हेड ब्रेन के ऑर्गन्स होते हैं वो अच्छे से वर्क कर पाते हैं, जिससे हमारा नर्वस सिस्टम अच्छे से वर्क करता है, ऑक्सीजन सही से पहुंचती है हमारे हेड पे, ब्रेन में। प्रोसीजर इसके
यस, कंटिन्यू करिए।
kneel and bend forward, bring the top of your head on the floor। पहले हमको घुटने फोल्ड करके फ्लोर पे बैठना है, वज्रासन में बैठना है। उसके बाद
हम लोग वज्रासन में हमको बैठना है। देन हमको हमारे हैंड्स जो है वो ऊपर हमारी बॉडी को स्ट्रेच करने के लिए हैंड्स अप करेंगे, एंड देन हम चेस्ट के साथ ऑन द ग्राउंड वी विल पुट आवर हेड ऑन द ग्राउंड विद आवर हैंड्स, एंड जो हेड का हमारा प्रेशर है वो बहुत लाइट टच होना चाहिए ऑन द ग्राउंड। एंड ये रिलैक्सिंग आसन है, तो इसमें हम ब्रीदिंग को रखेंगे नॉर्मल ही, और ऐसा नहीं है कि हमको कोई प्रेशर हमारी बॉडी पे फील करना है। जस्ट जैसे हम लोग बिल्कुल रेस्टिंग पोजीशन हमारी बॉडी की होनी चाहिए। एंड कुछ टाइम तक इनहेल एक्सहेल करेंगे, और फिर हमारा जो हैंड्स हैं उनको पुश करके स्पाइन को इरेक्ट करके रोल करके एंड हम वापस वज्रासन में बैठ जाएंगे।
All right, continue please. Very good.
शवासना ये मोस्ट इफेक्टिव आसना होता है डिटैचमेंट के लिए। ये हमको सिखाता है कि हमको अपनी सारी डिजायर्स को, एक्सपेक्टेशन को, इफोर्ट्स को और जजमेंट नेचर को हमको सरेंडर कर देना है। Increase the benefits of the crown chakra. This pose by visualizing white light entering from the crown of the head and descending the Muladhara chakra spine as your inhale. इस शवासना में हम lie down जमीन पे लेटते हैं, तो हमारी स्पाइन सर पूरी बॉडी हमारी
आप
एक
अटके हैं तो यहाँ से पढ़ सकते हैं।
हमारी
आप पढ़
पूरी
सकते
बॉडी एक अलाइनमेंट में होती है, जिससे जो हम इसमें हम आंखें बंद करते हैं, लेफ्ट साइड अपनी नेक को टिल्ट करते हैं, नॉर्मल ब्रीथिंग करते हैं, और इसमें हम विजुलाइज करते हैं एक वाइट लाइट को अपने फोरहेड पे, जिसको हम बोलते हैं आसना चक्रा, आज्ञा चक्रा बोलते हैं, उसको एक्टिवेट करते हैं इससे। As you exhale, imagine the last rising back up the length of your spine to top of your head. नेक्स्ट मंत्र चैंटिंग ओम। ओम का मतलब होता है कि साउंड ऑफ द यूनिवर्स। ओम हेल्प यू एक्सपीरियंस द कंप्लीटनेस ऑफ द लाइफ ऑफ साइकिल। सेकेंड मंत्र इज साता नामा। सा का मतलब होता है सोर्स ऑफ द यूनिवर्स, ता मीन्स लाइफ, ना मीन्स ट्रांसफॉर्मेशन, एंड मा मीन्स रीबर्थ। द मोस्ट पावरफुल मंत्र टू अवेकन फ्रॉम द चक्रास।
फिर आता है पूर्ण अधः। इसका मतलब होता है कि हमारी जो नेचर है वो कंप्लीट है, और इनफाइनाइट कॉन्शियसनेस को हम किसके लिए हम इस मंत्र को चैंट करते हैं। द नेक्स्ट मंत्र इज ओम क्लीम श्रीम, जिसमें द वर्ड क्लीम इज डिवाइडेड इनटू 3 वर्ड्स, which is ka means cause, la means external body, and e means casual body. And the word shreem is associated with nature's beauty and love and abundance. Then the next mantra is Om Gam Ganpate Nama, which means I surrender myself to Lord Ganesha. It is the most auspicious mantra when starting something new, when you start something afresh in your life. You should chant this mantra for all the positivity, and this should be the first mantra, according to me, to start your day with and start anything you want to be successful in.
Nutrition for activate and unblock the crown chakra. Purple foods like eggplant, red grapes are great because they are the color of the crown chakra. हमारे क्राउन चक्रा का जो कलर होता है वो पर्पल कलर होता है, इसलिए हम अपने क्राउन चक्रा को, सहस्त्र चक्र को एक्टिवेट करने के लिए पर्पल कलर के फ्रूट्स लेते हैं।
पर्पल मींस हमें पर्पल कलर्स के फ्रूट्स, पर्पल कलर के फूड अगर इफ वी कंज्यूम, देन आवर क्राउन चक्रा विल बी अवेकन्ड,
Yes.
or will help in awakening the crown chakra. That's what you are trying to say.
Yes.
All right. Continue.
होता है कि सिर्फ खाने से नहीं, कभी कभी कोई कलर हम देखने से भी वो चीज हमको इफेक्ट करती है, हमारे मेंटली।
वियर भी कर सकते हैं, फिर तो हम पर्पल कलर वियर करेंगे तो उससे भी फर्क पड़ेगा। पर्पल हमारा इंटीरियर पर्पल का होगा, उसका भी फर्क पड़ेगा। आपका कहने का मतलब कुछ ना कुछ पर्पल से उसका कनेक्शन है, चाहे वो खाने में हो, चाहे वो सराउंडिंग्स हो, इंटीरियर्स हो, क्लोथिंग्स हो।
हमारी क्रोमोथेरेपी होती है, उसमें हम बताते हैं कि सारे चक्रा का अकॉर्डिंग हमको क्या खाना चाहिए, क्या पहनना चाहिए, उसी कलर से अपने चक्रा को बैलेंस करते हैं.
गुड, वेरी गुड, कंटिन्यू करें.
हर्बल टीज रिड्यूस ब्लॉकेज बाय प्रमोटिंग
आप
जो
बोलेंगे
हर्बल
जिंजर स्पाइस हैज क्लींजिंग इफेक्ट्स एंड प्रमोट्स स्पिरिचुअल क्लैरिटी. इसलिए कुछ ना कुछ इसके पीछे रीजन होगा, है ना. और भी बहुत सारे रीजंस होते हैं. जिंजर आप देखा जाए तो व्हाटएवर जो हमारी चाय है वो बिना अदरक की चाय पीना लोग पसंद ही नहीं करते हैं, स्पेशली इन सर्टेन विंटर एंड ऑल. 2-3 महीने का बीच में गैप देते हो तो दे दें. तो और भी बहुत सारी चीजें हैं. चलिए हर्बल टीज का बताइए.
हर्बल टी रिड्यूस ब्लॉकेज ऑफ प्रमोटिंग हेल्थ इन डाइजेस्टिव सिस्टम. जो हमारी हर्बल टी होती है वो जैसे हम किसी को ओबीस पर्सन जो होता है उसको हम हर्बल टी देते हैं, या उसको फैट को कम करने के लिए. तो ये हमारा इस ऐसा कनेक्शन है. डाइजेस्टिव सिस्टम अच्छा रहेगा तो हमारे जो बाकी बॉडी का फंक्शन होता है वो अच्छे से वर्क करता है.
ठीक है, कंटिन्यू करें. गुड.
जो अदर पर्पल फ्रूट्स होते हैं, पर्पल बेसिल, पर्पल कैबेज, cauliflower, purple potatoes. It's at the last conclusion, each chakra represent a spiritual energy that help us to understand ourselves better. The energy of the Sahasrara chakra residing at the top of the head is the realization of completeness. सहस्रा चक्र जो एनर्जी होती है वो हमको कंप्लीटनेस रियलाइज करने में हेल्प करती है. अटेनिंग हार्मोनी एंड सेरेनिटी इन बोथ बॉडी एंड माइंड enable us to overcome emotion barriers and clear the path toward spiritual alignment. These are references. Thank
No,
you.
now one question for all of our viewers. You talked about meditation, all right, in the beginning in your slide.
Yes, sir.
Meditation is a very common word. Lot of people say and preach each other. We say to each other, do meditation. Why don't you do meditation? Stress है, meditation करो. Meditation is very good. कहाँ जा रहे हो? मैं meditation करने जा रहा हूँ. आप लोगों ने meditation किया है? I'm asking you as a presenter. You both presented such a nice paper here, an informative paper. Have you done the meditation?
Yes, sir.
How
Every
to
day in the
start?
morning.
Every day in the morning.
Yes.
So, my experience about the meditation is, and I'm telling it open platform, that whenever I try to meditate, when I try to meditate and sit for meditation, this mind goes to so many other directions. It worries about the whole day. Lot of things comes. What are the challenges? So how to overcome these things? Give my example, and whatever I shared, lot of other viewers might be in the same position. We say meditate, but to me, I am failed till today, truly speaking, and I am waiting for the day when I would be able to meditate.
सर हमको ऐसा लगता
Rather than that, when I focus on something like doing some work, I involved so much in that work that gives me soothing effect, and I think that is meditation for me. When I am doing my work with full focus and just concentrating, for me that is meditation. According to Oshoji, meditation is when you're dancing, when you're singing, all right. But in most of the platforms, what I have heard, that meditation is just sitting silent and think. That is, my example is in front of you, is that it's hard. It's tough. So tell the other listeners how to do it. At your, whatever the experience you have, your final year students. कैसे करें मेडिटेशन? आप कैसे करते हैं? शेयर योर व्यूज.
जब हमने भी स्टार्ट किया था तब हमारे भी माइंड में आप ही की तरह फ्लक्चुएशंस बहुत आती थी. एंड जैसे आप बता रहे हैं कि आप ध्यान नहीं लगा पाते, बहुत डिस्टर्ब हो जाते हैं. हमारे भी ऐसा था पहले, पर सर धीरे धीरे करते करते ना जब थोड़ा टाइम निकल जाता है तो उसके बाद वो फ्लक्चुएशंस ना आनी बंद हो जाती है. हमको ऐसा लगता है कि अब बहुत सोच लिया, अब सब सोचने के लिए खत्म हो गया, अब कुछ नहीं है सोचने के लिए. तो
आप शून्य में चले जाते हैं ऐसा?
हाँ सर, पर
No, major, this is practical.
Yes, sir.
problem with lot of people. I encounter with lot of people would say that कि we are not able to concentrate. और मैंने भी आपको एग्जांपल दिया कि अगर आप किसी काम में फोकस कर रहे हैं तो यू फोकस दैट मच इन दैट यू आर लॉस्ट, एंड दैट इज मेडिटेशन. दिस इज माय डेफिनेशन फॉर द मेडिटेशन. वो मेडिटेशन है. आप कभी मैथ्स के क्वेश्चन सोल्व करिए, आपको रिसर्च का वर्क करिए, यू राइट अप 4-5 पेजेस, आप इतने उसमें खो जाते हैं कि आपको पता नहीं लगता, एंड यू फील वेरी वेरी सेटिस्फाइड. आपको पता नहीं आउटर वर्ल्ड में क्या हो रहा है. और मेरा ये मानना है कि मेडिटेशन में ऐसा ही होता होगा. मुझे नहीं पता आपको ऐसी फीलिंग आती है नहीं मेडिटेट करते वक्त?
आती है सर.
आप कहाँ बैठे हैं ये भी पता नहीं होता कई बार आपको. सो फोकस्ड. Anyway, nice presentation. You talked a lot about chakras and I shared my experiences. कोई इतनी बड़ी बात नहीं है, नॉर्मल थिंग है. और वेरी गुड प्रेजेंटेशन. ओके, आपका क्या कहना है? शिखा मैडम हमारे साथ हैं, उनको भी काफी लंबा अनुभव हो चुका है मेडिटेशन के बारे में. आप क्या, हाउ वुड यू डिफाइन एंड हाउ वुड यू से दैट हाउ वन शुड बिगिन इट?
Yes, sir. Actually, I also experienced the similar situation. फर्स्ट ऑफ ऑल जब मैं ट्राई करती थी मेडिटेशन के लिए, मुझे लगता था मैं डिटेल्स में नहीं गई थी, कुछ थॉरो स्टडी नहीं थी, तो मुझे लगता था जस्ट क्लोजिंग योर आईज इज लाइक रिलैक्सेशन एंड मेडिटेशन. बट इट हैज बीन सेड इन आयुर्वेदा, योगा चित्त वृत्ति निरोध. आपको अपना जो माइंड है और मन है उसको कंट्रोल करके एक जगह लाना होगा, कहीं किसी पर्टिकुलर पॉइंट पर कंसंट्रेट करना होगा. और प्रैक्टिस में ये बहुत डिफिकल्ट होता था. तो व्हेन आई स्टार्टेड क्लोजिंग माय आईज, मैं अपने जो आईब्रोज हैं इनका जो मिड पॉइंट है इस पर कंसंट्रेट करने की जो है ट्राई करने लगी. और एक रेगुलर प्रैक्टिस के बाद मुझे लगा कि एक फॉर डूइंग 1 डे और 2 डेज ये आपको कोई मेंटल रिलैक्सेशन नहीं देता है. बट अगर आप एक रेगुलर प्रैक्टिस में इसको फॉलो करते हैं तो जैसे ही आप अपनी आईज को क्लोज करते हैं एक फील ऑफ रिलैक्सेशन जो है वो स्टार्ट हो जाता है. तो इट इज अ मैटर ऑफ प्रैक्टिस. एंड ऑल्सो आई वुड लाइक टू एड दैट सर हैज बीन आस्क्ड अबाउट आसन. बच्चे, आप लोगों को पता है स्थिर सुखासनम कहा गया है. तो आसन जो है, ऐसे लोगों को एक मिसकंसेप्शन ये होता है कि आसन बहुत डिफिकल्ट पोजीशन होगा. बिल्कुल डिफिकल्ट पोजीशन नहीं है, बिल्कुल सुख आसन में आपको बैठना है और स्थिरता के साथ आपको बैठना है. तो एक कंटिन्यूअस प्रैक्टिस के अंदर जब आप इस प्रिंसिपल को फॉलो करते हैं तो आप ये देखिएगा कि आपकी खुद की फैकल्टी से अ लॉट ऑफ स्टूडेंट्स मेक रिकॉर्ड्स. हमारे जेवियंस जो है, इट इज अ मैटर ऑफ प्राउड कि हमारे जेवियंस ने जो है एक रिकॉर्ड बनाया है ऐसे आसनों को फॉलो करने में. और सर रियली इट इज अप्रिशिएबल कि ये लोग बहुत प्रैक्टिस करते हैं इसको. आई हैव सीन एंड आई रियली एडमायर ऑल ऑफ द.
इन्होंने कभी मेडिटेशन किया है या नहीं? सो शी शेयर्ड हर एक्सपीरियंसेस किया है. तो मैं तो कहूंगा अगर यू आर डूइंग इंक्रीज इट डेफिनेटली विल हेल्प यू. मैंने इसके बारे में आई हैव रेड अ लॉट कि इट रियली रियली हेल्प्स अगर आप रियली में मेडिटेट कर पाते हैं.
जी सर, आई थिंक आपके सजेशन के बाद अब तो ये रियली जो है करेंगे, मेडिटेशन जो है एक प्रैक्टिस में फॉलो करेंगे. थैंक यू सर.
थैंक यू. यू वेलकम.
थैंक यू सर.
Thank you, ma'am. Thank you, sir. Thank you, ma'am, and thank you, sir, for your valuable words. Ma'am, can I share something about my experience? Sir, can I share something?
Yes, sure.
Sir, kindly unmute yourself.
Yeah, you can share your experiences, and
Yes,
that is the real meaning of conference. That's what I was saying.
Yes, sir. Sir, मैम एक्चुअली जब तक मैंने योगा की स्टडी नहीं करी थी तो दैट टाइम मैं भी सोचती थी कि सिर्फ आंख बंद करके ज्ञान मुद्रा लगा लेना एंड या ध्यान मुद्रा लगा लेना एंड बैठ जाना, दैट इज योग एंड मेडिटेशन, जो कि सब लोग ज्यादातर सोचते हैं दुनिया में. लेकिन सर जब मैंने डीप स्टडी करी एंड अभी मुझे स्टूडेंट्स को पढ़ाते हुए बहुत अच्छा लगता है जब मुझे डीप नॉलेज मिला कि व्हाट इज योग. एक्चुअली सर जब हम पतंजलि योग सूत्र की बात करते हैं एंड पतंजलि हु इज द फादर ऑफ योगा, तो उन्होंने बोला है कि यम नियम आसन प्राणायाम प्रत्याहार धारणा ध्यान समाधि
ये सर 8 स्टेप हैं एंड मैम ये 8 स्टेप मिला के योग बनता है। तो आसन इज ऑन 3rd नंबर, यम नियम आसन प्राणायाम, प्राणायाम इज ऑन 4th नंबर एंड समाधि यानी मेडिटेशन धारणा ध्यान समाधि एट लास्ट। तो सबसे पहले जब हम यम का पालन करेंगे तब हमारा योग या मेडिटेशन समाधि पे हम लास्ट में आएंगे, तब हमारा योग कंप्लीट होता है। तो सबसे पहले हम जब यम को प्रैक्टिस करते हैं एंड सर यम में भी फिर 5 सब डिविजन्स आते हैं, अहिंसा सत्य अस्तेय ब्रह्मचर्य अपरिग्रह। जब हम अहिंसा नॉन वायलेंस की प्रैक्टिस करते हैं, जिसको गांधी जी जो सिर्फ एक अहिंसा अष्टांग योग में सिर्फ अहिंसा को लेके चले थे एंड ही बिकेम सो ग्रेट पर्सन जिन्होंने अहिंसा का पालन किया पूरे जीवन में। तो सर एक एक छोटा सा एक अहिंसा का पालन भी करना इट्स वेरी टफ, और बहुत बड़ी बात है कि आप अपने जीवन में सिर्फ एक अहिंसा को भी लेके चलें। एंड सर फिर नियम के भी फिर 5 सब डिविजन आते हैं, शौच संतोष तप स्वाध्याय ईश्वर प्रणिधान, जिसके अंदर सेटिस्फेक्शन है जो तप करता है। एंड तप का भी मीनिंग है सर कि जब हम अपनी ड्यूटीज को अच्छे से निभाएं और उसके मार्ग में उसके रास्ते में आपके जो भी कठिनाई आए, कुछ भी लॉस अप्स एंड डाउन्स आते हैं, उसको सहन करते हुए जब हम अपने कार्य को करते हैं, तो दैट इज कॉल्ड एज तप। तो यम नियम, देन आता है 3rd नंबर आसन। आसन है जैसे मैम ने बताया स्थिर सुखम आसनम, जिस स्थिति में हम बिना हिले डुले बिना किसी प्रॉब्लम के बहुत लंबे समय तक बैठे रह सकते हैं, उसको आसन कहते हैं। आसन फिर देन आता है सर प्राणायाम, देन प्रत्याहार। प्रत्याहार होता है विड्रॉल ऑफ सेंसेस, आपकी जो 5 सेंसेस होती हैं उनको अपने अपने ऑब्जेक्ट से हटाना एंड कॉन्सेंट्रेट करना, क्योंकि सर हम अटैचमेंट में जीते हैं, हमारे जो 5
बिल्कुल सही
सेंसेस
करी आप। मैं काफी कुछ समझ गया आपकी बातों से। तो मैं ये कि आप जो करते हैं डेली लाइफ में, उसमें भी आपको नियम से रहना पड़ेगा, उसमें भी
यस
रूल्स
सर,
रेगुलेशन अपने आपको बांधना पड़ेगा, तब जाके ये मन शांत होगा, तब जाके कहीं ना कहीं जो उन्होंने बताया पहले यम, उसके बाद की स्टेजेस आएंगी, तब अगर आप एक मुद्रा बना के बैठोगे तो मेडिटेशन होगा।
राइट
काफी
सर।
इंफॉर्मेटिव है। अच्छी इंफॉर्मेशन आपने दी। और ये
बट सर
ऐसा नहीं है कि आप कुछ भी कर रहे हैं और सुबह मेडिटेशन करने लग जाएं।
राइट
That's
सर, राइट।
how I understand it. Yes,
बट
continue
सर जैसा कि आपने बताया कि फ्लक्चुएशंस आते हैं, आप मेडिटेट नहीं कर पाते, तो सर उसका भी बुक में सॉल्यूशन जो ऋषि पतंजलि ने बोला है, अभ्यास वैराग्य अभ्याम तन्निरोध। तो आप डायरेक्ट मेडिटेशन भी करते हैं, कर सकते हैं। अभ्यास और वैराग्य यानी प्रैक्टिस एंड डिटैचमेंट की प्रैक्टिस से हम सर मेडिटेट कर सकते हैं, यानी अभ्यास जरूरी है डेली एंड वैराग्य डिटैचमेंट। तो सर देन वी कैन
नहीं, बिल्कुल सही आपने समझाया, बहुत अच्छे तरीके से समझा दिया है और इसको डिटेल में बताया है। तो मुझे भी अपने काफी क्वेश्चंस का आंसर मिल गया है।
थैंक यू
और जैसा
सर।
कि मैंने अभी बोला है, आई सेड फ्यू मिनट्स बैक कि नॉट ओनली मेडिटेशन, लॉट ऑफ अदर सब्सिडियरी थिंग्स यू
राइट
हैव
सर,
टू फर्स्ट कंप्लीट। उसके कुछ प्रीरिक्विजिट्स हैं, वो कंप्लीट करोगे तो हो सकता है मेडिटेशन हो जाए। तो लेट अस सी क्या होता है। एंड आई विल शेयर द सेम इंफॉर्मेशन विद अदर पीपल आल्सो who says that they have difficulty in doing the meditation. Thank you very much.
थैंक यू सर, थैंक यू मैम फॉर
Thank you,
गिविंग
sir.
मी द प्रीशियस टाइम। थैंक यू
Thank you, sir, for giving us the precious time.
Thank you. You can announce lunch now. It is lunchtime. 1 o'clock is about to be there, or it's up to you in your notification. And if you want to bring any one more student, it's up to you. However, better to announce lunch because it is 1 o'clock, and 2 o'clock you can bring other speakers and other presenters for presentation. All right.
Yes, sir. Yes, sir.
Thank you.
Okay. Thank you so much, sir, for being with us. Okay, Anushka ma'am, now we are officially announcing the lunch, and after the lunch, we will all collect again and we will start our presentations.
ओके मैम,
Thank you so
थैंक यू
much.
मैम।
Namaste, everyone. Welcome to the post-lunch session of the Studies International Seminar on Stress Relief and Lifestyle Disorders Management in Context of Vedas. I again welcome all of you and our guest speaker for the post-lunch session, Dr. Vishwa Vasugod sir, is here among us. Namaste, sir.
Namaste.
Very warm welcome to you, sir.
Thank you.
Let me introduce our guest speaker without delaying. Dr. Vishwavasu Gaurji is Assistant Professor in the Department of Swasthvit and Yoga, MJF Ayurved Mahavidyalaya, Chomu, Jaipur. And also he is member Board of Management in Dr. Sarvapalli Radhakrishnan, Rajasthan Ayurved University, Jodhpur. He belongs to a family where Ayurvedic principles are usually followed in a regular routine. Also, he is the son of a very respectable, intellectual, and renowned personality, my Guruji, Professor Banwari Lal Gaurji sir. तो सर आपकी फैमिली में जो है वी ऑल नो कि आयुर्वेदा को बहुत अच्छे से फॉलो किया जाता है एंड सर जो हैं उनके बहुत अच्छे लिटरेचर आयुर्वेदा के ऊपर अवेलेबल हैं एंड स्टिल ही इज वेरी एक्टिव इन द फील्ड ऑफ आयुर्वेदा प्रैक्टिस सो आई वेलकम यू सर और let you start your session.
Thank you.
Uh, 1 minute, sir. Another guest speaker is also there. Dr. Leena is there. Dr. Leena, ma'am, namaste. How are you?
I'm fine, and I'm fine.
Okay, ma'am.
Very good.
Welcome
Namaste.
to this post-lunch session. Here, I have introduced the guest speaker of this session, Dr. Vishwavasu Gaurji, and he will present
Namaste.
his. Yes, ma'am. He will present his presentation, and you are also welcome. You will be speak later.
Yes, thank you, madam.
Okay, thank you, ma'am. Yes, sir. Now you may start, sir.
Presentation is visible or not?
Yes, sir. It is visible.
Okay.
You are sharing your slides, sir.
Yeah, 1 minute. Entire screen is visible or only slide is visible now?
No, sir. Your slide is invisible.
Okay, just a minute. It's uploading. Slides are uploading now.
Yes, sir. Yes, sir. We are waiting.
It's visible?
Now it is visible, sir. Yes, sir. It is visible now.
Fine. So I'm thankful to organizing committee of the university for inviting me to give a lecture on lifestyle disorders and their management through Ayurveda. In this modern era of science and technology, man has become more and more physically inactive and getting attracted towards unhealthy food articles like fast food, cold drink, liquor, smoking less, regular eating pattern, shorter meals, etc. Everyone is running towards life's goal and not following proper dincharya, ritucharya, and ahar vidhi. Because of this unhealthy lifestyle, human beings have unknowingly invited number of diseases that disturbs physical, mental, as well as social health of an individual. In fact, a person have to be live in harmony with the environment, surrounding environment. But nowadays it's not happening, and he's attracted towards the things, and more or less he's not aware of the fact about the Ayurvedic principles also. For that, we have to uh, follow proper steps that like in primary prevention or primordial prevention, we have to educate people about the Ayurvedic lifestyle, then only they can follow it. Then role of Ayurveda in management of lifestyle disorders. Ayurveda, the age-old science of life, has always emphasized to maintain the health and prevent the disease by following proper diet and lifestyle regimen rather than treatment and cure of the disease. The basic principle followed in the Ayurvedic system of medicine is Swasthasya Swas Rakshanam and Aturasya Vikar Prasmanam. So main aspect of Ayurveda is preventive as well as curative also, but for preventive benefit we have to follow Ayurvedic principles. For this purpose, the Dincharya and Ritucharya have been mentioned in the classics of Ayurveda. The pathogenesis of lifestyle disorders in relevance of disturbed dincharya. The modern lifestyle is a major cause of many non-communicable diseases, especially lifestyle disorders, and also triggering factor for diseases like cancer, IBS, appendicitis, renal stones, etc. People's diet changed substantially in the second half of 20th century, generally with increased consumption of meat, dairy products, vegetable oils, fruit juice, and alcoholic beverages, and decreased consumption of starchy staple foods such as bread, potatoes, rice, and maize flour, and also so called we called millets. This year also we are going to celebrate about millet. These observations suggest that the diet or lifestyle of different population might partly determine the rates of cancer and other lifestyle disorders such as obesity, diabetes, cardiovascular disease, etc. As well as nowadays we are seeing many patients of ulcerative colitis also. And from Ayurveda lifestyle we can also manage, as well as from Ayurvedic medicine and Ayurvedic lifestyle. In the morning, late awakening, and at night, late sleeping has become common. Both of these habits have many adverse consequences of health. These faulty habits cause loss of concentration, mood disturbance, headache, and stress. In case we sleep late in the night, the cortisol hormone secretes, which increases hypertension. And in morning, if we we follow of awakening in the Brahma Muhurat, then serotonin hormone secret, that is also a mood enhancer hormone that increases our brain capacity to learn more and more. Late night sleeping, then one bad habit results into many other bad habits. Late night sleeping causes late wake up in the morning, which again causes skipping breakfast and results more dependency on junk and fast food. These habits increase the risk of obesity, diabetes mellitus, hypertension, cardiovascular diseases, etc. Lack of exercise and yoga also results into non-communicable diseases. Drinking not enough water in a day is also a triggering factor for renal stones, constipation, as well as nowadays gout problem is increasing because of increased uric acid. Many researchers predict that high frequency emerging from cell phones increases stress level and may also cause vision problem. Continuous use of air conditioner may result into chronic headache, fatigue, mucous membrane irritation, breathing difficulties, and may enhance the pre-existing problems of arthritis and neuritis. With the change in season, the change is very evident in the environment we live in. We see various changes in biolife around us, such as flowering in spring and leaves shedding in autumn in the plants, hibernation of many animals with the coming of winter, and so on. As human being is also part of the same ecology, the body is greatly influenced by external environment. Many of the exogenous and endogenous rhythm have specific phase relationship with each other, which means that they interact and synchronize each other. If body is unable to adapt itself to stressors due to changes in specific traits of season, it may lead to those Vaisamya, which in turn may render the body highly susceptible to one or other kinds of disorders. As adaptation according to the changes is the key for survival. The knowledge of Ritucharya regimen for various seasons is thus important. People do not know or ignore the suitable types of food stuffs, dressing, and other regimen to be followed in particular season. This led to rearrangement of homeostasis and causes various diseases such as obesity, diabetes, hypertension, cancer, and so on. Lifestyle diseases are a result of an inappropriate relationship of people with their environment. Onset of these lifestyle diseases in insidious, delayed development and difficult to cure. According to the doctors, a sedentary lifestyle combined with an increase in the consumption of fatty food and alcohol is to blame causes of obesity, diabetes, hypertension, and so on. Like various modalities of Swasthret for preventive care from lifestyle disorders. If each of us are better known about this, and the persons who are affected from lifestyle disorders are general public, so we have to educate more and more persons about the various modalities of Ayurveda from which they can be benefited, like daily regimen, that is Dincharya, seasonal regimen, Ritucharya, Ahar, Nidra, and Brahmacharya, that is Traya Upastambh, Palan, Sadvrit, Achar, Rasayan, Ashtang Yog, as well as other key factors like to suppress Dharaniya Veg and not to suppress Adharaniya Veg, not to consume Viruddha Ahar, not to indulge in Mithyahar and Vihar, not to do Heen, Mithya, and Ati Yog of Indriya, Kai, Vak, and Manas, not to do Pragya Parat, not to consume Gun, Matra, Des, and Kal Viruddha Ahar. Then, first of all, we discuss about daily regimen, that is Dincharya. Brahma Muhurat, it's the best time to awake, according to Acharya. So, in the ancient, the our Ayurveda system was so much advanced that they know the benefit of awakening during Brahma Muhurat. As during Brahma Muhurat, the air is fresh and we can get pure and good oxygen that time, as well as that time our serotonin hormone also secretes, so it's the best time to learn something. Then other procedures that should be followed are Dant Dhawan, Jimva Nirlekhan, cleansing of teeth and tongue, Usapan, drinking water. Nowadays, the as we are discussing upon lifestyle disorder, person generally awakes in the morning and suddenly they ask for morning tea or coffee instead of Usapan. They prefer drinking other these drinks like tea and coffee. If we drink water that is near about 650 ml or 700 ml water that time, it is beneficial to detoxicate the whole things, like in the morning we after drinking water the person urinates and most of the toxins get rid through that. Then Malotsar bowels. Another same thing is happening nowadays about bowel movement. Most of the persons are suffering from constipation because they are not in habit to of usapan and to go pass their stool timely. Most of the students in nowadays go to school after wake up, and after having their lunch time at home they go to for Malotsar. It is the main cause of various lifestyle disorders. Then Netri Praksalan, eye care, Nashya, Abhyang, oil massage, Vyayam, and Chankraman, that is morning walk, Snan. After daily regimen, we will come to Ahar diet. Ahar Vidhi Vidhan described in our classes are the foundation of dietetics, which indicate the method of Ahar. These are we person have to follow Ahar as well as Vihar according to Ritu, various Ritus seasonal. The various seasons are there in our India also, like basically in the heavier room, these are Sheet, Usn, and Varsa, and Separately, they are in 6 ritus. And according to ritu, we have to follow our ahar. Ushna Snegna Matravat is consumed after the digestion of previously ingested food. Virya Avirud Ahar is to be taken into East Dese, where it is to be provided with East Sarvopram, not to be taken speedily, not to be taken too slowly. Taken without talking with others, taken without laughing, taken with the concentration of the mind. But now, what happening nowadays? We generally take our dinner uh, watching TV, so it is not good. So we are not fully concentrated how we have to watch TV, when we have to watch TV, and when we have to eat our meals. So we have to be fully concentrated by while taking our meals. Ushnam Asniyat, consuming warm food. Warm food tastes good and doesn't pacify Jatragni. Food is easily digested as food has to come to body temperature for digestion. Wath and cough are pacified on taking warm food. Heating also kills microbes. On taking cold food, more energy will be used for digestion, which may lead lethargy. So warm food should be consumed. So person have to consume warm food, but not re-warm food. Nowadays, what happening? Persons are preferring pizza, burger, and many other things. They are simply presented in their cold storages, like refrigerators, and thereafter again they rewarm it in microwave. So it is not preferable. Food has to be taken fresh and warm, not rewarm. Then Matravat Asniyat, balanced diet. According to Ayurveda, Matra amount is one of the two type, that is Sarvagray whole amount, and another is Parigray amount of individual ingredient. So the diet must consist of variety of food items in proper amount from different groups so that it contains all micro and macronutrients. Balanced diet does not disturb dosic status of body, enhances longevity, gets digested and passed out without any problem. Amount of the diet should be according to Agni and Bal of the body. If we do not follow the balanced diet, then malnutrition will be happen. It may be for malnutrition, like lack of nutrients, or excessive nutrients, like in case of obesity. So we have to follow balanced diet. Then Jirnam Asniyat, meal taken after digestion of previous meal. Next meal should be taken after digestion of previous meal. This prevents adhesion, which lead to arm formation, which is the root cause of majority of diseases. On taking meal in Ajirnavastha, Grahani dosha and vitiation of all dosas occurs. So the diet should be taken after digestion of previous diet, as Charak says, Kal Bhojan Arogya Karnam. In case we don't follow this rule, and if our previously taken meal doesn't digest it, and then it will result in formation of arm, that is impaired product of digestion, and it will result in various disorders. Virya Aviruddha Asniyat. It is essential to take Virya Aviruddha Ahar to prevent problems arising due to Viruddha Virya Ahar, such as impotency, blindness, Rakta Vihar, Grahani, Amvis, hypersensitivity, Kushth disorder, sore, fever, etc., and may even cause death. Like if we are taking milk, we should not take other snacks like containing salts. It will result in various disorders, skin disorder, as well as we should not take milk with various fruits. Like we are taking various fruit shakes nowadays and with milk. So it is not good, because milk and fruits both have different digestive time, and they get fermented in case we take them together. East, they say East Sarvopram Chasniyat. Meal taken at proper place and with proper instruments. Meal should be taken in proper place and with proper utensils so that hygiene is maintained and no stress arises during meal. In a stressful condition, cortisol level increases. Increase in negative mood in response to stress led to greater food consumption. What happens nowadays, that there are so many takeaway restaurants are there, like McD and many others, in which you can directly drive through and order your food, and in the next counter, you while driving you can have that meal. What happens? Our hands are not tidy, that are not clean properly. We are driving through steering so many people. If not one person is driving the same car, then there are also various infections are there. So we should have our meals properly and at proper place. Eating should in congenial place provided with all necessary accessories. One eating at congenial place does not get depressed in the mind by the depressing emotions produced in unpleasant environment. Nati drutam asniyat, not eating too fast. What happen nowadays? We are getting late for our office or college or school. We are in hurry and suddenly we took our breakfast or sandwiches and other things. Children are also doing the same things. They are running with their sandwiches and toast toward the bus, eating them in that way. That is not good. If food particle goes in respiratory tract, it can cause choking or other respiratory tract infections or problems like GERD. If food is taken in proper speed, enzymatic juices mix properly so food get easily digested. Brain takes about 20 minutes to recognize that stomach is full, so eating with optimum speeds prevents overeating. Eating slowly can decrease food consumption, preventing overeating. Better absorption of nutrients, better appetite regulation, and better satiety. We have to churn our food properly through teeth, and thereafter only we have to swallow it. Nowadays we are eating directly, and it directly goes through food pipe to stomach. Undigested food particles goes outside. We are also not getting proper nutrition that we have to be through that food. Naati vilamb asniyat, not eating too slowly. If food is taken too slowly, it is not properly digested as enzymatic secretion do not mix properly with the food, leading to improper digestion. One doesn't get satiated, eats more, and more food gets cold. Similarly, as Jalpan Hassan Tanmana Bhunjite. So we have to follow all these principles while taking the food. Considering all above mentioned rules, it can be concluded that ahar should be taken as per ahar vidhi vidhan, dietary guideline, which are truly scientific as mentioned by our acharya. So we have to follow proper ahar guidelines according to Ayurveda, as well as follow proper dincharya. Then sadvrit, good moral conduct. What happens in lifestyle disorders? Not only physical, by also psychosomatic disorders are there. Mansik rogs are also there. If we follow sadvrit, good moral conduct, it is good. Ayurveda is the ancient age that guides you in maintaining a healthy mind and body. There are many secrets in the Ayurveda knowledge for the happy living. There is separate chapter called Sadvrit. These are the simple moral principles and the right conduct that is applicable to all people of all the times and place. If we violate or ignore these guidelines, we are going to suffer ultimately. Then Achar Rasayan. Rasayan Tantri is one of the eight major division of Ashtanga Ayurveda. In Ayurveda, one of the major methods of presentation of positive health has been described. That is Rasayan. On following good conduct, moral conduct, the similar benefits we will also get from that conduct as we are having from the Rasayan Dravya. Then Ritucharya, in Ayurveda, knowledge of Ritucharya is a first-hand guide to the concept of Kriya Kal. All of us and have to educate persons about the Ritucharya. Then, according to Ritu, what we have to do and what we don't have to do, as well as for lifestyle, as well as of eating behavior. If we are eating the heavy meals in Grishma Ritu or Varsha Ritu instead of Hemant and Sisi Ritu, then it's normal that we will have some diseases and aggravated dosas, because dosas should be alleviated and in balanced state if we have to be healthy. And nowadays what happening that persons are eating momos and other heavy materials, heavy food materials in the areas having cold season. Similarly, they are following the same things here where the weather is warm. What will happen there? That food will not digest and impaired product of digestion, that is arm, will be there. So Ritu act as Vyanjak or Nimitt Karan in the aggravation and manifestation of diseases. And according to Ritu, we should be follow the various Panchakarma procedures for purificatory of our body. Like Vaman Virechan Karm should be done properly accordingly, and use of Anuvasan Basti also should be done, and other Basti during rainy season. In Sarad Ritu, we should guide persons to have Virechan Karm, and during Vasant Ritu, to get rid of aggravated cough dose, we should do Vaman Karm. Then yoga. Yoga is very good, and nowadays we are also celebrating International Yoga Day every year. So implementation of Ashtang Yoga in Yam and Niyam already towards the good Mansik health, good good mind to by using Yam and Niyam. Yam, Ahimsa, Satya, Aste, Brahmacharya, Aparigraha are essential of internal peace and happiness. These principles guide a person to remain intact from those behaviors which may disrupt the mental harmony and inner balance. Similarly, the Niyam also like Soch, Santosh, Tap, Swadhyay, Ishwar Pranidhan are the observance and what to do and what not to do for the purification of the body and mind along with contentment, firm determination and self-study. Observance of these rules lead to good health. So by following yam and niyam, we can do well for our mind, and asan pranayam we can do for both our body too. And asana and pranayam especially act on physical and mental health. They improve body strength, dispel out of the toxins from body, relax body and mind, reduce stress and establish balance between sympathetic and parasympathetic nervous system. Various physiological changes occurs in the body by doing proper asana and pranayam. Relieves stress and anxiety, boost positive energy, help normalize blood pressure, speed up sluggish digestion by massaging surrounding muscles, increases feeling of calm and well-being. It can reverse the stress response, thereby provide a shield against the effective of chronic stress, slow down heart rate and breathing, normalizes blood pressure. Oxygen can be used more efficiently, adrenal glands produce less cortisol, improves immune functions. Then we come to Rasayan. The Rasayan, if we follow proper Rasayan karm, then also person remains healthy because of boost of immunity. By Rasayan Dravya, we can boost our immunity because in earlier days, only it was a Rasayan come through which the children as well others are being immunized, or our Vyadi Samat was increased by use of Rasayan. Earlier, the Acharya has also told about various Lehan Karma use of gold with various grit. It is the main purpose was to immunize person. Nowadays, various vaccines are available, but no, those days the children were immunized or increased Vyadi Samat was there by use of Rasayan. Rasayan therapy works to promote healthy life by preventing the disease. Rasayan means the science of rejuvenation. The branch of Rasayan or rejuvenation is one of the 8 specialized branches of Ayurveda that primarily deals with the maintenance of health. Nowadays, what due to disturbed lifestyle, persons are having most of the changes, like some are having low vitamin B12, low calcium, and many other things. These things can be uh, cured and managed by use of Rasayan Dravya. Then there are different types of Rasayan like Nemitic Rasayan, Ajasik Rasayan, and Kamya Rasayan. According to mode of administration, Vatatapik Rasayan and the Kuti Pravesik Rasayan. Nowadays, everyone can have Vatatapik Rasayan by doing their work also, and also having Ahar Rasayan dietary modalities following the rules relating to eating. Already we have discussed about it. Celibacy, Dravya Rasayan, Osad Rasayan. Then benefits of Rasayan therapy: enhancement the intelligence, memory power, willpower, body strength, skin luster, sweetness of voice, and physical strength. It nourishes the Sattva Dhatu and prevents chronic degenerative changes and illness. So it increases strength of Dhatu and protect from chronic degenerative disorders like arthritis and senile diseases. Rasayan deals with preventive health for enjoying normal life. Rasayan was designed in classic Ayurveda as an effective tool to synthesize the excellent quality of dhatu that entails the prevention and alleviation of sanity and diseases. So various types of Rasayan according to age. And rasayans are adaptogenic, and adaptogen is a metabolic regulator which increases the ability of an organism to adapt to environmental factors. Then antioxidant, various antioxidants we can have through it. After Rasayan, we can talk about the various types of holding Vegas. If we hold different types of Adharni Veg, then various physiological changes occurs and person suffers from various types of disorders like holding urine from a long time due to attending a meeting or any other cause will result in various disorder related to urinary tract. Similarly, we have to follow all the Ayurvedic principles if we want to be healthy. That is the also a preventive aspect of Ayurveda for Swasthasya Swasth Rakshanam and Atras Vikar Prasmanam Cha. And we have to follow that Dharma Artha Kama Moksha due to Arogya. So we can achieve it through Arogya. So we have to follow proper lifestyle following the proper principles of Ayurveda. Thank you. I think the time limit was 30 minutes.
Yes, sir. If you continue this session, you would like to continue, then you may continue. The presentation was very good and interesting.
Okay, that's why I have done it a little bit faster because time limit was 30 minutes. But already we have discussed that various forms of modalities of Ayurveda, everyone have to follow. And most it is a very good effort through your university. You are trying to educate more and more person as this session and all the seminar is also available on YouTube. You are broadcasting it in YouTube that many persons will be benefited through it. So main thing that is a concept of prevention like primordial prevention, primary prevention, secondary prevention, tertiary prevention. If we prevent persons from having disease, then most of the cost of our health will be prevented. Like more than 70% diseases nowadays are lifestyle disorders. And if we educate people about it, then the cost government have to bear on those diseases and the population have to bear the cost on the diseases can be prevented, and that cost is good for development of the country. So it is better to follow principles of Ayurveda like various dharni veg. If we hold dharni veg, then person will be more happy in the sense like nowadays people are very aggressive, getting aggressive day by day, like any other cause like in people are sitting in the staff room, they are discussing on a topic, that topic suddenly goes hot, and that hot topic result in stress. A main cause of like various disorders are like depression is there, anxiety, stress are happening. Why? Persons are not using proper lifestyle. They are awakening late night. They are firstly they are doing habitually that they started sleeping late, but when this thing continue for many years, then they want to sleep, but that thing doesn't happen. So it is a main cause. Like so many patients are coming nowadays, they are saying that we are not having good sleep. Why not good sleep they are having? Because they forcefully they try to awake for late night, despite of they are using smartphones or having partying. So all the things are disturbed nowadays. If we eat proper food properly timely, then all the things, because all the things are timely in our body, that If a fixed time is there for breakfast, lunch, dinner, timely our digestive juices get secrets. Timely the saliva comes in the mouth, and the suddenly carbohydrate start digestion by use of salivary amylase. Thereafter through food pipe it goes to our stomach. There hydrochloric acid through gastric juices, it protein get digested. Also the pepsin that needs acidic medium also get digested, help in digestion of protein. Thereafter food, the most of the digested food goes to small intestine. There are also again pancreatic juices are and bile all are flushed into the small intestine for digestion. There is medium is alkaline. So thereafter small intestine, the villi present in the small intestine absorbs most of the digested food material, and thereafter food goes to large intestine where most of the water get reabsorbed from it. And through thereafter from ileum, colon, or rectum, the undigested or residue food material get rid of our body. So all the things are timely, all the things need timely. If we disturb that time schedule, the gastric juices will also not be released timely, because they know, the body knows time. If you disturb the timing of the body, then the similarly our digestive system will be affected through it. That's why if a person awakes timely in the morning, he remains healthy for years. Most of the acharya you see. One thing also I am seeing at my home also, my father is following the routine. He had written so many books. Always he wake up at 4 a.m. in the morning and goes to bed by 9 p.m. So it's a lifestyle that protects a person through various diseases. Now he have a lot of time. He visits various places for giving lectures, seminars, and also daily he have time for 8 to 10 hours to write several articles as well as various books. Why these things is happening? Only due to a good lifestyle and following the principles given by acharyas in Ayurveda for Brahma Muhurat. He is awakening in the Brahma Muhurat, and good hormones are there, like serotonin. Similarly, persons late night sleeping, having hypertension problems are there, more hemorrhages are there. Nowadays in clinic, several persons who are working in various MNCs throughout India are visiting. They are having hypertension, stress, so much stress. They are feeling various severe depressions also. Various persons, they are getting good salary, but they are not happy. Why? Because of bad lifestyle. Few persons are there, many patients are there, they have a working schedule, different working schedule. They are working in MNC for a US based company. There the, like we are speaking about lifestyle, also ritucharya, ritu pattern is completely different here. As here they are working in afternoon and night session through 2 3 p.m. to 11 or 12 a.m., 11 p.m. to 12 a.m. they are working. So whole body system is disturbed. Now they are sleeping by 2 a.m. and getting awake by 10 a.m. in the morning. They have no time to go for yoga or exercise. So for them, they can do yoga or exercise according to their time. We Because they can't leave work, but they can adjust or adapt according to that. Their body can adapt easily, so they have to follow the same routine. Their acid level is very high because they are having their meal in the midnight. So these are the lifestyle changes of and not following proper dincharya and proper ritu charya. Similar things are
Yes.
happening. Yeah.
Yes,
So
sir.
any other speaker is
Thank you,
there?
sir. Thank you, sir. You delivered a very awesome lecture on this, and you tried to cover all the aspects. And now we have another guest speaker
Okay.
from Sri Lanka.
Okay.
She will also speak on this topic, lifestyle disorders and their management through Ayurveda. So, thank you, sir, for be with us.
Thank
Thank
you
you so
and
much
namaskar.
for giving
Yeah,
your precious time.
thank you.
Thank you, sir. Now, I would like to request Dr. I am Lena. Madam, first of all, very warm welcome to you in this post lunch session.
Madam, give me the option.
Ma'am, echo is there in your sound. Dr. I am Leena Ji is senior lecturer at Department of Shalya Shalakya and Prasuti Tantra, University of Colombo, Sri Lanka. She is continuously working hard for the promotion of Ayurveda in Sri Lanka. So thank you, madam. And ma'am, I would like to thank you for accepting our request in very short duration and
Cannot screen share.
yes, ma'am.
I cannot screen share.
Yes, ma'am. Share your screen, ma'am. We are waiting for your presentation.
Madam, something wrong with my file. My screen is share.
Ma'am, echo is there on your sides. Here, you are visible on two screens, ma'am. Ma'am, kindly unmute yourself. Dr. Leena, ma'am, kindly unmute.
Yes, madam, I am sound is from phone. That's why.
Okay, ma'am.
But unable to share the screen. My screen is not showing.
Are you sharing your slides?
Yes, I tried, but not coming into share.
Still, your slides are not visible, ma'am. You are visible on three screens, ma'am. Dr. Leena, ma'am, is trying to connect with us. There is some technical issue. In the previous presentation, Dr. Vishwavasu Gaurji shared all the
No,
knowledge
no,
and
technical
information.
team should get her PPT shared.
Yes, sir.
आप टेक्निकल टीम को बोलो उनकी पीपीटी शेयर कराएं. Am I audible to you, Shikha madam?
Yes, sir.
Yes. So it's very easy. She
Technical
has to
team,
open the presentation and then go on. Tell her if she can do or who is coordinating, or she can. Yes, I think that will be the best idea. It's very
yes,
easy to
sir.
share.
Yes, sir. Technical
क्यों नहीं
team,
share?
please try to share
Please,
her slides.
next
You are
the
audible,
I
ma'am.
think
Dr. Leena ji, you are audible.
I think there is some network issue or something.
I am trying to share her slides. I'm giving a presentation to our technical team.
Am I audible to you, Lina ji? If you can hear me. I think there is a lot of.
Due to some technical issues, Lena ma'am is not able to connect with us.
Yes,
Madam,
madam,
screen is the
screen share is the
problem.
problem.
No,
Ma'am, we are
what
able
can
to
be done
share
in
your
adverse
slide.
hold on, please listen. What can be done in adverse situations? She can give her present. She can talk about what she was planning to talk without presentation. You know, अपना वो एक्चुअली क्या है कि जो उनको बोलना है वो बोले तो सही, टॉक करें, एक्सप्लेन करें कि इस टॉपिक पे व्हाट वाज द टॉपिक, ऑल दैट इफ पॉसिबल. Yes, I think something is coming up.
Without PowerPoint, may I do?
Yes, we can see your PowerPoint presentation.
Ma'am, our technical team has played your slides.
Now she can explain. They have
Lena
done
ma'am?
it.
Lena ma'am, your presentation is on the screen. Your slides are here visible. Dr. Lena ma'am? Dr. Lena ma'am? Am I audible, ma'am? Sorry for the inconvenience. We will take this lecture in next session. Now we will invite research scholar Dr. Chanchal Suryavanshi for his presentation. Yes, welcome, sir.
Thank you so much, ma'am. I'm audible, ma'am?
Yes, you are audible.
Okay, ma'am. My screen is visible, ma'am? My screen is visible, ma'am?
Yes, it is visible now. Yes, sir.
Okay,
It is
thank you so
visible.
much, ma'am. Thank you, everyone. My name is Chanchal Suryavanshi. I am PhD scholar, Department of Integrative Medicine, Sri Devaraj Arts Academy of Higher Education, Research, Kolar, Karnataka. So today my study title is the effect of Trimurti Dhyan on the mindfulness attention of university students, a pilot study. Actually, mindful is nothing but at a time how many percent you attend like that. Okay, so come to the introduction part. According to research, 20-25% of students are unexcused at any one moment, and 50% of students may suffer anxiety and despair as a result of their stress. So, currently, related to stress, so many disorders, uh, problems like that. For mental health disorder, anxiety, depression, PTSD, OCD, eating disorders, cardiovascular disorders like hypertension, coronary artery disease, heart attack, and stroke. And gastrointestinal disorder related IBS, IBD, GERD, peptic ulcer, autoimmune disorder, rheumatoid arthritis, SLE, and endocrine related disorders, adrenal disorder, thyroid disorder, diabetes, sleep, and other disorders like that. Okay. So while mindfulness practice decrease stress and anxiety, it also increase attention and focus. Student cognitive performance, emotional and social intelligence, support student who battle with perfectionism and memory. So इसके बेस पे जो है हम लोगों ने देखा कि स्ट्रेस को कम करने के लिए और माइंडफुलनेस को इम्प्रूव करने के लिए हम लोगों ने एंशियंट इंडियन त्रिमूर्ति ध्यान मेडिटेशन जो है उसका उपयोग किया। तो उसके लिए जो है बताया जाता है कि जो त्रिमूर्ति ध्यान जो है वो ध्यान बिंदु उपनिषद से रिलेटेड है। और ध्यान बिंदु उपनिषद जो है वो शुक्ल यजुर्वेद से रिलेटेड है। और शुक्ल यजुर्वेद उपनिषद जो है वो 20 योग उपनिषदों में से एक उपनिषद है। और ध्यान बिंदु उपनिषद जो है ये लगभग 100 बीसी से 300 बीसी जो है वो पुराना मेडिटेशन टेक्निक है। तो इसमें जो श्लोक संख्या 30, 31 और 32 उसमें बताया गया है कि अस्थि पुष्प संकासम नाभि स्थाने प्रतिष्ठितम चतुर्भुज महाविष्णु पूरकेन विचिंतये। अर्थात जो नाभि स्थान है, अर्थात मतलब कि मणिपुर चक्र भी जिसको हम कहते हैं, मणिपुर चक्र में नाभि स्थान पर भगवान विष्णु अलसी के पुष्प पर विराजमान है और उनके स्वरूप का दर्शन है उस पर ध्यान करने के लिए बोला गया है। नेक्स्ट श्लोक में बताया गया है कुंभकेन हृदय स्थाने चिंतकेन कमलासनम ब्रह्मांडम रक्त चौराभ्यम चतुर्भुजम महापितामह। मतलब जो पितामह है कुंभक करते समय, श्वास को होल्डिंग करते समय हृदय स्थान है, हृदय के स्थान पर चतुर्भुज चार भुजाओं वाले ब्रह्मा जी जो कि सृष्टि की रचयिता है, जिनको हम पितामह कहते हैं, उनका ध्यान हमें करना चाहिए। ठीक है। थर्ड श्लोक है रेचकेन तो विद्यात्मा ललाटस्थम त्रिलोचनम शुद्ध स्फटिक संकासम निष्फलम पापनाशनम। तो पाप को नाश करने वाले त्रिलोचन और ललाट में जिसकी तीसरी आंख उपस्थित है, ऐसे भगवान शिव का ध्यान जो है श्वास को छोड़ते समय आज्ञा चक्र पर हमें इसका ध्यान करना चाहिए। सो while the past research has shown that practicing mindfulness meditation can reduce stress, improve focus, enhance emotional regulance, increase resilience, improve sleep, uh, reduce symptoms of depression, lower blood pressure, and reduce chronic pain. So, in this study, we use using methodology. The participant selected by the following criteria: inclusion and exclusion. So, inclusion criteria is healthy subject of age group between 18 to 30 years, only men will be included. Exclusion criteria is regular practitioner of yoga, subject with spine related disorder, subject who play sports on regular basis, gym practitioners, swimmers, patient with psychiatric disorder, chronic disease patient like that. So in my study design is RCT randomized control trial. Sample size is total 30, 15 in each group. Participant or setting is Sri Devraj Arts Academy of Higher Education Research Center campus. And intervention I give Trimurti Dhyan for 20 minutes each day, 5 day a week for 6 weeks. So here I mentioned Brahma, Vishnu and Shiva's photos. So इन इमेज पे जो है वो स्टूडेंट्स ने जो है वो 20 मिनट्स तक जो ध्यान किया पूरा कुंभक और रेचक के अकॉर्डिंग। इसके पहले हम लोगों ने क्या किया था कि इस जो कंसेप्चुलाइजेशन किया था इस टेक्निक का, आफ्टर दैट डेवलपमेंट एंड आफ्टर दैट लाओ से सीएच स्कूल 1975 के मॉडल से इसको वैलिडेट किया था। वैलिडेट करने के बाद में हमने इसके ऊपर पायलट स्टडी डिजाइन करी थी। नाउ असेसमेंट टूल माइंडफुलनेस अटेंशन अवेयरनेस स्केल क्वेश्चन, इसमें टोटल 15 क्वेश्चन जो थे वो अवेलेबल थे और 15 क्वेश्चन में टोटल सभी क्वेश्चन में 6 ऑप्शन मौजूद थे, जिसमें पहला ऑलमोस्ट ऑलवेज, वेरी फ्रीक्वेंटली, somewhat frequently, somewhat infrequently, somewhat very frequently, almost never, like that 6 ऑप्शन मेंशन थे। जिसमें से अगर लो स्कोर है इसका मतलब माइंडफुलनेस जो है वो नेगेटिव फॉर्म में है, और अगर हाई स्कोर है तो जो हमारा माइंडफुलनेस अटेंशन अवेयरनेस स्केल का जो स्कोर है वो अच्छा है, हाई है। So statistical analysis and independent sample t-test was used to make between group comparison between the control and dhyana group. Come to the result section. So I will present table 1. So socio-demographic comparison between control and dhyana group. So control group in 15 sub participants and dhyana group in also 15 participants. Age mean is 23 3.13 and dhyana group age group is 24.66. Come to the table 2. Within the dhyana group, pre and post comparison of the mindfulness attention awareness scale score. So mass score item average pre in Dhyana group 3.79 and post 4.40. So total percentage change in 16.09, effect size is 1.03 and p value is also 0.00 means highly significant. So come to the table number 3. Within the control group pre and post comparison, the mindfulness attention awareness scale item.
Excuse me, sir.
Yes, ma'am, tell me.
Chanchal sir, your only first title slide is visible here.
Okay. Okay. Ma'am, I will try again. Okay.
Yes, sir.
Mm, uh, मैम अब शो हो रही है
It will. Yes, sir. Yes, sir.
मैम
Now,
ओके मैम ओके
yes,
मैम
now
कैन
it
आई
is.
प्रेजेंट again or continue
I think you may continue, and the third slide of result is now visible on the screen. It
मैम ये वाली
is.
शो हो रही है
It is
ये
third
वाली
topic result. Yes, sir. Third
ओके
point
मैम
result.
यस मैम
It is 8 number slide, sir.
1 minute मैम मैम ये मेरी इसमें तो शो हो रही है मैम
Yes, sir. अब visible है ये.
Okay, ma'am. So, come to the table number 1, socio-demographic comparison between control and dhyana group. So, total number of participant 30, but control group in 15 and dhyana group in 50. So, age average is 23.13 and dhyana group 24.66. And come to the table number 2, within the dhyana group pre and post comparison of the mindfulness attention awareness scale score. So pre is 3.79, post is 4.00, and percentage change is 16.09%, effect size is 1.03, and p value 0.00 means highly significant. Ma'am, this screen is visible. Slide number 9.
Yes, sir. It is visible.
Come to the table within the control group pre and post comparison of the mindfulness attention awareness scale. So pre is 3.66 and post is 3.70. Percentage change is 1.63. Effect size is 0.07. P value is 0.511 means not significant. And come to the table number 4 between group control versus dhyana comparison of the mindfulness attention awareness scale. So average pre dhyana and control post and dhyana and control. So pre means the not significant 0.68 p value and post dhyana and control group 0.00 means highly significant. So this is a figure 1 graph of mean item average. So स्टार्टिंग में जब हम लोगों ने कंट्रोल ग्रुप को लिया था तो उसका जो मीन था वो 3.66 था. सेकंड पे जब पोस्ट में हमने कंट्रोल का लिया तो उसका 3.72 और प्री ध्याना ग्रुप का जो लिया तो 3.79 था. आफ्टर दैट जो पोस्ट ध्याना ग्रुप था वो 4.4 था. सो इसका मतलब ये हुआ कि जो ध्याना ग्रुप था, ध्याना ग्रुप को हमने त्रिमूर्ति ध्यान इंटरवेंशन दिया था, वो जो था उसका रिजल्ट बहुत अच्छा था, हाईली सिग्निफिकेंट. सो कम टू द डिस्कशन पार्ट. The primary goal of this study was to look into the influence of the ancient Trimurti Dhyan technique on modern university student attentive attention. Mindfulness can assist a student in improving their focus on concentration, which can result in improved academic achievement. Students are under a lot of pressure to perform well academically, which may lead to a lot of stress and worry. Mindfulness has been demonstration to be beneficial strategy for a student in lowering stress and anxiety. As a result, children will be better able to control their emotion and stress reaction due to stronger sense of self-awareness. So come to the conclusion part. The effect of Trimurti Dhyan from the Dhyan Bindu Upanishad on university student was studied, and it was discovered that those who practice Trimurti Dhyan practice an extraordinary improvement in mindfulness attention. Increased mindfulness attention improved self-esteem, confidence, empathy, and compassion. Focus, concentration, self-awareness, positive self-image, and self-acceptance improve. There is also a reduction of tension, anxiety, and concern. As a result, doing Trimurti can help you solve any mental difficulty. So this is references in APA 7th edition format, and continue referencing all. And presentation is complete. You have any questions, please ask me. Thank you so much.
Thank you, sir, for your presentation.
Thank you.
Leena ma'am, Dr. Leena ma'am.
Yes, madam.
Yes. Now, are you able to join and share your slides?
No, please share, madam. I'll by phone I'll come. Can you share my PowerPoint?
Uh, Let me check, ma'am. I will inform you. Let me check. Please wait for a second, ma'am.
Okay, madam. मैं क्या देखा फिर मैंने मैं क्या देखा फिर मैंने था ये क्या कहीं लगा हुआ
Now I am inviting our intern, internee, Dr. Preeti, for her presentation.
Dr. Preeti, ना इंटर्न कनेक्ट कराना अयो वो चल गया like to express my sincere gratitude to organizing committee of this international conference, Jyoti Vidyapeeth Women's University, Jaipur. Especially, I would like to say my heartfelt gratitude to Professor Vinod Swamiji to inviting me to share my knowledge with you. Lifestyle disorders is an umbrella term given to all the diseases which arise because of unhealthy lifestyle. The most common lifestyle diseases include hypertension, diabetes, arthritis, obesity, insomnia, which are the major cause of mortality in today's world. Not only are these lifestyle diseases frustrative, but these are also interfering with natural comfort of well-being. Lifestyle disorders were more common in Western world, but the scenario has changed dramatically. Developing countries like Sri Lanka, India is predicted to have most number of lifestyle related patients in the next 10 years in the entire world. As Ayurveda is recognized as foremost life science and described ways to prevent the manage lifestyle disorders, the world is being attacked toward its potential. Ayurveda provides better solution in the forms of proper dietary management, lifestyle advices, panchakarma like detoxification and biopurification procedures, medicament and rejuvenation therapies. The holistic approach of Ayurveda treating the patient as a whole, meaning intervention targeted toward complete physical, psychological, and spiritual well-being makes this science wonderful option in lifestyle disorders. Ayurveda main name is Swasthasya Swasthya Rakshana Aturasya Roga Prashamana. Before 2-3 decades ago, infectious diseases are more common in the world. Now, scenario has changed. Non-communicable diseases are increasing. What are the causes? The most common causes of lifestyle disorders are eating unhealthy foods, overeating, overdependence, and processed food, energy drink, and artificial sweetness, and fast food. Sedentary lifestyle, smoking, drinking alcohol, stress, poor sleeping habit, which are all attributed mainly to the so-called modern living habits and urbanization and with the altered eating habits make the situation worse. There is another important problem of the modern world that is poor exposure to the sunlight and the fresh air. Diet and lifestyle are major factors thought to influence susceptibility to lifestyle diseases. The nature and duration of work, the amount of time you spare for exercise and recreation, the time you spend with your loved one, the stress factors, your physical activity, etc., decide on how soon you are likely to land up in one of the any lifestyle disorders. More work and no pay makes a lot of us prone to diseases. Along with that, there are certain other factors such as hereditary, age, and gender, which cannot be avoided or controlled. But the other factors that can be avoided or controlled are drug abuse, wonder about the incidences of according to the non-communicable disease country profile 2014. WHO mentioned that diseases like cancer, chronic respiratory problems, and cardiovascular diseases are the biggest global killer, accounting for 38 million deaths every year, with the wolf in countries. This is the life expectancy at birth in Sri Lanka. Female 78 years and male 72 years. With increasing prevalence of lifestyle disease in India, one out of 4 Indians is at risk of dying from non-communicable disease like diabetes, cardiovascular ailment, or cancer before the age of 70, according to the estimate of various global organizations. These are the main causes for death in Sri Lankan people: stroke, ischemic heart disease, chronic respiratory disease, and diabetes. If we consider about the top lifestyle diseases, Alzheimer disease, it is a brain cell breakdown disease. There is no permanent solution from modern medicine, but good nutrition may show the progress of the lifestyle disease, slow progress of the disease. Atherosclerosis also major disease nowadays facing the people. Cancer diseases characterized by uncontrolled abnormal growth of the cells. There are five top more cancers, especially main prostate, lung cancer, colorectal, and bladder, and Hodgkin lymphomas. In most common cancers in the women, breast cancers, lung cancers, colorectal cancers, uterus cancers, and ovarian cancers. And chronic liver disease and cirrhosis also play a major role in lifestyle disorders. Also diabetes, a disease affecting sugar use by the body. There are four main types of type 1, type 2, type 3, and type 4. Heart diseases, any of several abnormalities that affect the heart muscle or the blood vessels of the heart. Heart disease has been number one cause of the mortality and morbidity. And nephritis and chronic renal failure, any disease of the kidney marked by swelling and abnormal function. Characteristic of kidney disease are bloody urine, persistent protein in urine, pus in urine, difficult urination, and pain in the back. Stroke, a condition that to lack of oxygen to the brain that may lead to reversible or irreversible paralysis. Stroke is linked to advanced age, high blood pressure, previous attack of poor circulation, and cigarette smoking, and so on. Continuous and long time work without break. This is usually related to people working in financial sector and IT professional. They can develop the disease such as a spinal cord problem, carpal tunnel syndrome, multiple sclerosis, joint pain, dementia, depression, anxiety, and many other diseases. And there may be malignancy, occupational lung disease, silicosis, fibrosis, asbestosis, cerebrovascular diseases, and use of junk food, packed food, and long time period food due to that cancer growth maybe there are nutritional deficiencies, so some skin diseases and computer vision syndrome. Nowadays it is a more common in the small children also due to bad uh, excessive exposure of the screen. Anxiety disorders, addiction of smoking, asthma, bronchitis, respiratory disease, and depression. These are more common in nowadays. What we can do from Ayurveda? Preventive measures. Daily practice of some yoga like Surya Namaskara yoga practice can also be oriented in the prevention of disease involved. Practice of pranayama, chanting of some mantras daily, reading of the religious books daily, decreasing the usage of mobile phone, computer, and smartphone, making both mind and body feel comfortable by Sadhuta. Surya Namaskara, one can daily, and pranayama also daily practice. It is better to prevent the respiratory diseases due to bad lifestyle. Now lifestyle disorders are more common in developing country like Sri Lanka also. Many people are going to clinic and heart disease and diabetic clinic like that. Ayurveda is always Ayurveda prays the prevention is better than cure. Prevention through Ayurveda. According to Ayurveda, basically the cause of any lifestyle disorder is prajna parada. A particular lifestyle of person is a cumulative product of his her physical capacity oriented with psychological functioning displays in the form of habits, behavior, dietary and living pattern based on his own training, sought from childhood and impression he gained from his immediate companion, including parents, siblings, and peers. It involves a pure psychological and innate control over the physical and sensory activities. When this innate control, the coordination are disturbed, it leads to the arrangement of
Shreya ma'am,
lifestyle and result. it leads
Dr.
to the
Neha, ma'am?
rearrangement. Yes,
Sorry
madam.
to interrupt you, ma'am. The time slot has been over now.
Okay, okay, madam. I'll finish. Prajna Parada also.
Okay.
Ayurveda is applying Sadhuta and Ahara, and Ahara is the main role. Nachahara samang kinchit baisajjam upalabhyate. Kashyapa has mentioned, and Yukti Vapasre as well as Daiva Vapasre Chikissa and Satvavade Chikissa, applying the Dinacharya, Ritucharya, and use of Panchakarma is more benefit to prevent the lifestyle disorders. Ayurveda emphasized the preventive aspect of the Panchakarma and Rasayana therapy also, and Achara Rasayana, and ideal routine in the early go to the bed and early wake up. Rasayana has immunomodular, adaptogenic, and antioxidant properties. Ayurveda offers some code of good conduct under the heading of Sadhuta and Achara Rasayana. The conduct under Sadhuta and Achara Rasayana can be categorized into personal, limited sexual relation, and sleeping, awaking, avoid excess exertion, and so on. These are very benefit to ones who follow the Sadhuta and Ayurveda Dinacharya healthy lifestyle can prevent the lifestyle disorders. Thank you very much. Sorry for the inconvenience occurred due to me, and I would like to express my sincere thanks to organizing committee as well as the Professor Vinod Swamiji to inviting me this platform. Thank you very much, madam.
Thank you so much, ma'am, for being with us. Thank you and have a good day, ma'am. Now, I would like to call our internee, Dr. Preeti, for her presentation. Over to you.
Namaste, CEO, sir, and advisors, sir, and respected teachers and all guests. Good afternoon, Javin. I Javin P.K. Gupta, Antonia BMS 2017 batch. Today I am here for presenting my presentation. The topic of role of diet and lifestyle in management of Madhumeh. In Ayurveda, Pramay is one of the 8 Maharoga. When all type of Pramay is not treated properly on time, when it turns out in Madhumeh. मधुमेह को पढ़ने से पहले हम पहले प्रमेय के बारे में जानेंगे कि प्रमेय क्या है। प्रमेय महारोगों में से 8वां प्रमेय होता है अकॉर्डिंग टू आयुर्वेद। प्रमेय क्या होता है कि जैसे कि
Hello,
बार बार अधिक मात्रा में मूत्र का निकलना, गंदे मूत्र का निकलना, उसको प्रमेय कहते हैं। लेकिन जब प्रमेय मतलब कि बार बार अधिक मात्रा में मधु के समान और मधु के जैसा मधुर मूत्र का निकलना, उसको मधुमेह कहते हैं। क्योंकि मधुमेह 2 वर्ड से मिलकर बना होता है। मधुमेह, मधु प्लस में, मधु का मतलब होता है मधुर और में का मतलब होता है मूत्र। मतलब कि जो मूत्र है वो मधु के समान मधुर दोनों के साथ का निकलना। or than etiology. Hereditary and diabetic, two factors are generally responsible for madhumeh. Lack of exercise activating factors, laziness, sweets, fast food. According to Ayurveda, causes of madhumeh are नींद रसा प्रयासी नवन आनपानम गुडवैकृतम च प्रमेयम हेतु कफ कृष सर्वम. अकॉर्डिंग टू आयुर्वेद मधुमेह के पूर्व या फिर निदान आप बोल लो या फिर जैसे कि कौच, तो आज से सुख का मतलब होता है कि जो सुख पूर्वक आसन पे बैठे होते हैं, स्वप्न सुखम जो सुख पूर्वक सोते रहते हैं, दही की जो दही का सेवन करते हैं, गाँव में उत्पन्न फल रसा जो दही का सेवन करते हैं, जो जलीय जीवन पशुओं का सेवन करते हैं, नए गुड़ का सेवन करते हैं, जिससे उनकी जो कफ है वो विकृत हो जाती है. दुष्यंत प्रमेय दोष और दुष्यंत, दोष तो इसके तीन होते हैं, कफ और पीत और वात. दुष्य होते हैं मेद, रक्त, शुक्र, वसा, लसिका, मज्जा, रस, ओज और मंत्र. क्लासिफिकेशन ऑफ प्रमेय. There are three types of प्रमेय, कफ, पित्त और वातज. लेकिन कफ के भी 10 प्रकार होते हैं, जैसे उसमें उदक में आ जाएगा, इक्षु में, सांद्र प्रसाद में, शुक्र में, सित में, सिक्ता में, सनारि में, अलान में. और पित्त के 6 टाइप्स है, सार में, कला में, नील में, लोहित में, मंजिष्ठा में, हरिद्रा में. और वातज के 4 होते हैं, वसा में, मज्जा में, अस्थि में और मधु में. अब मधुमेह के बारे में हम पढ़ेंगे. तो इसका डेफिनेशन है कि मधुमेह इज कंपाउंड वर्ड मेड अप ऑफ 2 वर्ड्स मधु प्लस में. जैसा भी इसके पहले में हमने बता दिया है कि मधुमेह कैसे होता है. तो मधुमेह is a disease in which urine of patient is similar to honey and quantitatively increased as well as staying pale and rough in quality, and whole body of madhumehi becomes sweet. Madhumeih is a type of Vataj Prameh. Sign and symptoms of Madhumeh: excessive thirst, sweet taste in mouth, bad breath, burning and numbness in hand and feet, abnormal frequent urination, excessive hunger, blurry vision, weakness, drowsiness, trembling dizziness, dry and itchy skin. Management of Madhumeh. According to Ayurveda, patient may be classified as under there are 2 types of diabetes, अस्थल और क्रूज. अस्थल मतलब ओबेस और क्रूज एस्थेमिक या भी लेन पेशेंट बोल सकते हैं. अस्थल ट्रीटमेंट मस्ट बी मेनली बेस्ड ऑन प्रॉपर यूटिलाइजेशन, एक्सेस फैट that is should be शोधन, अवतर्पण. शोधन में करेंगे कि एक्सेसिव रिडक्शन इन बॉडी वेट बाय वे ऑफ डाइट कंट्रोल, फिजिकल एक्सरसाइजेस, वमन, विरेचन, बस्ती. लेकिन बस्ती देंगे तो उसमें अनुवासन, बस्ती और स्नेहन का उसमें निषेध किया है, क्योंकि मधुमेह में तो प्लेग का प्रकोप ज़्यादा होता है. ट्रीटमेंट पर lean patient mainly based on the line of increasing stamina and vitality by way of tonics, diet and drugs. डाइट एंड लाइफस्टाइल. आहार में जम्बो, कपित्व, अमलकी, गोधूम, यव, स्मॉल मील्स, फ्रीक्वेंट इनटेक, यव, मोदक, मेथी, पटोल, कटु, कसाय. Katu and kasai are main drugs because they improve fat and carbohydrates metabolism. Bihar, yogasan, meditation for stress management, exercises. योगासन के लिए उचित त्रिकोणासन, भुजंगासन, मंडूकासन, धनुरासन, पवन मुक्तासन. ये सब आसन करा सकते हैं मधुमेह रोगी को. और औषधि के लिए मतलब जो मेडिसिन हम मधुमेह पेशेंट को देंगे वो सिंगल और कंपाउंड फॉर्मुलेशन दोनों में देंगे. जैसे स्वरस में देंगे अमलकी, हरिद्रा, गुरुची, नीम पत्र और 10 ml ट्वाइस अ डे देंगे विथ मिल्क और हनी. और पात में फलात्रिकादि देंगे, मुस्तादी देंगे, मंजिष्टादि देंगे और चूर्ण में त्रिफलादि मुस्तादी, वटी में देंगे चंद्रप्रभावटी, 500 mg बीड़ी विथ वाटर, इंद्रावटी देंगे, प्रमेय अंटक वटी, नेहा मुदयार गुटिका 1 ग्राम पानी के साथ देंगे, दसन कुसुमाकर रस 250 ग्राम mg में देंगे इनको सुबह शाम विथ हनी। ग्रीत में देंगे धनवंतरी ग्रीत, सलमन की ग्रीत, त्रिकंटक ग्रीत 10 से 15 ml सुबह और शाम। इन्वेस्टिगेशन में लिपिड प्रोफाइल कराएंगे, ब्लड ग्लूकोज कराएंगे, फिर यूरिन टेस्ट भी, ओरल ग्लूकोज टॉलरेंस टेस्ट, लिवर बायोकेमिस्ट्री। जो मधुमेह के रोगी होते हैं उनके पथ्य के लिए जौ, मूंग, चना, चने का आटा, करेला, नीम, त्रिफला, आंवला, मरीच, ये सब खाने को देंगे। और जो खाने के लिए नहीं देंगे वो है दूध, गुरु, अविसंधि भोजन, अनुपमास, मधुर, अम्ल, दही, घृत, तेल, गुड़ और उड़द। और करेला और पटोल का जो जूस है वो ज्यादा देंगे क्योंकि वो कसाई और कटु दोनों ही होते हैं, जो मधुमेही रोगों के लिए ज्यादा बेनिफिशियल होता है। थैंक यू मैम, थैंक यू सो मच।
The next presenter. Is
Yes,
anybody
sir.
else or all are done for today?
I'm calling the next presentee named Pallavi, and her topic of presentation is preventive and curative aspects of Ayurvedic management of obesity.
Namaste, CEO and Advisor Sir, and chief guest, and my all teachers, and dear JPS. I JP Pallavi Sharma, BMS intern. My topic is preventive and curative. My topic: preventive and curative aspects of Ayurvedic management of obesity. हमारे आयुर्वेद में ओबेसिटी को स्थौल्य भी कहा जाता है। इंट्रोडक्शन: Lifestyle disorder can lead to many health problems like cardiovascular disease, arthritis, hypertension, obesity, etc. Lifestyle disorders are increasing very rapidly all over the world due to faulty eating habits, lack of physical and mental exercises, sedentary lifestyle, stress, etc. Obesity is considered as globally rising epidemic disorder. In present
present era, obesity is the most alarming and challenging lifestyle disorder. In Ayurvedic context, Thaula is predominantly Kapha Pradosha Vikara. Kapha dosha, Agnimandra, and variation of Medo Dhatu are most significant factors in pathogenesis of Atisthalia. Preventive measures of Sthalia are group अपतर्पण चिकित्सा, लघन चिकित्सा, etc. Panchkarma procedure like लेखन बस्ती, उद्वर्तन, वमन, वेचन, निरुह बस्ती, कर्षण नस्य, etc. Definition of Atisthalia obesity. A person who has excessive growth of fat and flesh is unfit to work and disfigured with pendulous buttocks. Belly and breast is called atisthul and condition is termed as atistholia. Obesity is an increase in body weight beyond the limitation of skeleton and physical requirement as the result of excessive accumulation of body fat. BMI body mass index more than 30 kg is also used for diagnosis obesity. In the context with obesity, exogenous causes are maida, potentially diet and regimens where are dosha. दोषक थ्री टाइप के होते हैं वात पित्त कफ धातु जिसे बॉडी टिश्यूज कहते हैं वो 7 टाइप के होते हैं रस रक्त मांस मेद अस्थि मज्जा शुक्र मल 3 होते हैं मल मूत्र पुरुष त्रुसक बॉडी चैनल्स कहते हैं अब आएंगे साइन एंड सिम्टम्स पे मेदो मांस अतिवृद्धि चल स्पीक उदर स्तन अयत उपचय उत्सना यानी मेदो मांस अतिवृद्धि excessive growth of muscle and fat tissues चल स्पीक उदर स्तन pendulous buttocks abdomen breast अवत उपचय उत्सना disproportionate strength with his physical growth दुर्गंध bad smell sweet breath more sweating अति क्षुधा excessive hunger अति पिपाशा excessive thirst अब क्लासिफिकेशन ऑफ स्थौल्य ये 3 टाइप के होते हैं हीन स्थौल्य मध्यम स्थौल्य और अधिक स्थौल्य अब स्थौल्य हुआ है तो कुछ कॉम्प्लिकेशन भी हो सकते हैं जो आयुर्वेद के अकॉर्डिंग है डिसीज हो सकते हैं आम रोग अपची अर्श अतिसार भगंदर ज्वर कामला काश कुष्ठ मूत्रकश और भी कई व्याधियां हो सकती हैं अगर ध्यान नहीं दिया तो अब हम चिकित्सा पर जाएंगे मैनेजमेंट हमारे आयुर्वेद में 3 प्रकार से चिकित्सा की जाती है निदान परिवर्जन संशोधन और संशमन पहला निदान परिवर्जन इसका फर्स्ट the line of treatment in निदान of particular disease about a proper time may help arresting the pathogenesis of the disease अगर हम पहले कारणों को अच्छे से जान लेंगे उनको बढ़ने ना देंगे तो हमें ये व्याधि होगी ही नहीं अब आएगा सेकेंड संशोधन शोधन थेरेपी इज डन इन 2 ways बाह्य शोधन और आभ्यंतर शोधन बाह्य शोधन इन अभ्यांग स्नेह स्वेदन लायक और अभ्यंतर शोधन हमारे आयुर्वेद में वमन बस्ती विरेचन एक्स्ट्रा Samshamana is defined as the therapy which does not do shodhan of the dosha, nor disturb the question of balance dosha. ड्रग्स यूज इन स्थौल्य हम कौन कौन सी औषधि यूज कर सकते हैं संशमन योगा लाइक कोची भद्रमुष्टा त्रिफला तक्रारिष्ट माक्षिका विडंगादि लोहा विलवादि पंचमूला and Silajatu with Agnimantra Swaras are advised for prolonged periods. Harithi is advised for the treatment of Santarpanya Janya Roga and Amraki is mentioned as Midupaham. So Harithi and Amraki can be used for treatment of scalp. डाइट हम क्या क्या डाइट कर सकते हैं डाइट मस्ट बी न्यूट्रिशनली एडिक्यूट बट मस्ट बी लोअर इन कैलोरीज with vitamins and mineral supplements, a mixed balanced diet in a sensible approach to long-term weight reduction. एक्सरसाइज ताड़ासन चक्रासन एक्स्ट्रा और भी कर सकते हैं हम पथ्य में क्या ले सकते हैं डूज और डोंट्स पथ्य में जैसे हम खाने में आहार जौ करेला सलाद या मूंग दाल यानी हल्का खाना में खाना चाहिए और हमें ड्रिंक हाफ अ ग्लास ऑफ वाटर जस्ट बिफोर फूड खाने से पहले हमें थोड़ा पानी पीना चाहिए और नींबू का उपयोग अधिक से अधिक करें क्योंकि खाते समय भी और पीते समय भी पाचन का कार्य करता है और बिहार में रेगुलर एक्सरसाइज करें उपवास भी कर सकते हैं और अपथ्य में हमें जो नहीं करना चाहिए जो नहीं खाना चाहिए फ्राइड एंड ऑयली फूड अवॉइड करें फास्ट फूड अवॉइड करें स्वीट्स अवॉइड करें आलू चावल चीनी अधिक और बिहार में अधिक सोना अधिक खाना लेजीनेस एक्सेट्रा कम करें कंक्लूजन Obesity is a serious and highly prevalent disease associated with increased morbidity and mortality. Ayurveda management are safe, effective, and economic for this disease without any side effect. In Ayurveda, Ahara, Vihara, Dincharya, Ritucharya, Yoga, Rasayan are described which have good role in prevention and cure of the obesity. The prevention and management of obesity can be done successfully in Ayurveda. Thank you.
So, today's conference first day was very hectic, and some inconvenience was due to bad weather. But at the last, I would like to thank all the dignitaries for being with us in this conference first day. President IC sir is with us continuously. Thank you, sir, for supporting us throughout the day.
You're
And
welcome.
I would like to thank our Honorable Advisor, Sir, Vedant Girgi, Sir, respected Registrar Madam, Dr. Hima Baflaji, President IC, Sir, Pro-President Ayush, Sir. He is not here now. But in tomorrow's session, Dr. Hima Baflaji, our Registrar Madam, will join us and bless us. And next day, we will continue these sessions. So that's all for today. Have a very good day, everyone. Thank you so
Thank you
much.
very much, and all the best for tomorrow's second day of this conference. Thank you.
Thank you, sir. Thank you. Jai Mata Di.
Jai Mata Di.